So we will record our session. We will post that to our webpage along with the updated PowerPoint, because we've had some changes just here actually even today. So
I think Suze is going to be late, so we can start.
With that, this is our meeting agenda. We have a very full agenda, as you can see.
Said he was good.
Please, if you're not speaking, please remember to mute, because we can hear your side conversations. Keep that in mind. We're going to all have to work together to make this meeting successful, and that's a key part of that. We do want people to collaborate, but at the same time, we also have be aware that we really want to cut down on background noise. So that being said, as you can see, we have a full agenda. We're going to have a lot of opportunity to collaborate and discuss. Please don't be bashful. Please share your knowledge. I know that everyone on this call has important things to share about their agencies and their work, and a lot of people will have questions and comments, which is great. We want you guys to collaborate, so please do so. I will do my best to try to pause to allow time for you guys to unmute and then speak. So I'll try to remember to do that. But you may also use the chat, in order to help us to kind of recognize you with the information you may have. So please use that, or please just unmute and also speak. And please don't have a problem with interrupting if we're discussing something that you have a valuable point, because we need that to occur at times. So with that, I've got the meeting agenda screen up. Like I said, please go ahead and use the chat box. Plenty of opportunities for collaborate, committees, town hall, agency reports, etc. Any of the topics we're going to discuss, a wide range of topics. All right, so we have some special guest speakers today, and I think they're on the call, but there's a lot of folks on the call, so I haven't necessarily seen their names, but the first person we have lined up to speak is Brenda from the South Dakota Department of Social Services. She's actually the Deputy Cabinet Secretary. She was going to speak a little bit about COVID-19 testing. And then we have a couple of guests too from Collaborative Solutions. They're technical assistance providers that have been working with us especially on the Emergency Solutions Grant, as to do particularly with the COVID rollout, but they've been providing assistance in a number of areas. So they're also going to be speaking a little bit. But I think, Brenda, are you on the call? Maybe she wasn't able to join. She may have got caught up in something else.
It looked like her name is on the list.
Okay, you might need to unmute. I should have checked if you guys can hear me, but evidently you can, Denise. Thank you.
Hi, this is Kim.
Yep, I can hear you.
But I'm on another meeting till 11.
Oh, she's having trouble. Okay, let's.
Brenda, there is a call-in number too, if you want to call in.
Thanks, Denise.
We'll add the information into the chat box here so you can see it.
There you go. Perfect. Don't worry. I mean, as we work with our remote meetings and things, I think everyone's pretty understanding that there's different technical issues that can come up. So there's the numbers in the to call in. And I see that, and there's still people continuing to enter the meeting, which is great. I know folks are super busy. So go ahead, if you're entering the meeting, please, if you can, type your name and agency in the chat, and that way we'll track your attendance. And we'll just give Brenda a few moments to call in, and hopefully that will work. And we have flexibility in our schedule too, so we'll make it work one way or another. Looks like we're up to nearly 70 participants. Oh, conference ID. Oops. Oh, you probably already beat me to it, Denise. Oh.
Yeah, it's 33683. It's right at the end of the number there.
Oh, right there. Yep. 33683. That's the ID. Okay. You know, we're all meeting so much this way, and it seems like, you know, there's a lot of different platforms, and they're all just a little bit different.
Good morning. Can you
Good
hear
morning,
me?
Brenda.
I apologize. I'm not sure what's happening with my Skype audio, so
No
thanks
problem.
for the flexibility and for your patience.
Thank you for joining our meeting today. We really appreciate you taking the time to provide the PowerPoint and to come on and talk with the consortium. So thank you.
Great. Do you want me to just go ahead and get started, Davis?
Yeah, go ahead and just let me know, like, if you'd like me to advance the slides, and I'll do that.
Okay, that sounds good. Well, thank you for inviting us to join your meeting today. We actually, I think, have a couple other folks on, it looks like from the chat, that are part of a statewide effort that we'll talk about here. So I'll start and just kick off that for the past several months, we've had several kind of interagency, interstate agency groups dealing and kind of working on different efforts and, you know, different key focus areas relative to the state's COVID response. One of those work groups is referred to as Special Populations work group, and the kind of focus of that group is the working with facilities across the state that provide services to individuals in congregate settings. And so in the Department of Social Services purview, that includes facilities like our behavioral health providers, and I see we've got an individual on from BMS in Rapid City. That also includes our psychiatric residential treatment providers for youth. So and examples there would be Abbott House, if you're familiar with services that they provide. And then with the Department of Human Services, that entails, those settings include community support providers. South Dakota Achieve, Lifescape, might be a couple of facilities that folks might be familiar with. And then we also have representation in our group from the Department of Public Safety with their crime victims program. And so we're working with some of those domestic violence shelters. And so Tom Martinic with the Department of Health and myself co-chair this group. Again, we've got a couple other representatives from our group on. Caitlin Thomas is with the Department of Health, and she's on today as well. And Caitlin has been very instrumental in just leading a lot of different initiatives for the Department of Health, but in particular, some of the work early on in our efforts for sure around testing and testing support. That'll be the focus of what we'll kind of talk about today. And then Rebecca Baird, also on our group with the Department of Health, and she's on the call, I believe, here today. And Rebecca and her team have really just been outstanding in dealing with lots of different issues with another track within the Department of Health, and that's dealing with supporting folks with isolation and quarantine needs. And so that's part of the work that they do to support our overall effort. And so, recently, and as we've been kind of working through this response, we recognized that we had a gap in our group relative to the homeless population and homelessness. Individuals that were, whether they were sheltered or unsheltered, as we kind of continue to work through our processes. And so graciously, Davis and Denise have joined our group very recently, and so we're very excited about that. Today what I'm going to be talking about is some of the efforts to date that our group has been focused on that really focus around testing and supporting different types of testing in congregate settings. So that'll be the bulk of kind of what we talk about today. And then, of course, we all know, and very exciting news yesterday, that the vaccine distribution has started in South Dakota. And we would envision our team and the points of contact on our team are really going to be helping to support, as the vaccine becomes more available, we're a resource then for these partner agencies that provide services in congregate settings to help bring awareness and facilitate vaccination for special populations. So with that, Davis, do you want to go ahead, and I think you can skip ahead to the next slide here. So I think we've so again, we're going to talk today about a couple of different types of testing and kind of what's been happening there. And I'll start first. Let me just pull up my slides here. So let's just start a little bit. I'm trying to see where we're at here. Okay, so the state's kind of statewide testing plan really has had several strategies. And again, our group is really just one part of this larger testing plan. So, there's other groups that have been working with hospitals and nursing homes and other groups. And so we're, again, our group that we've been working with collaboratively with our partners has been focused on these targeted kind of special populations. So the strategies at a statewide level are, making sure there's access to testing, in particular for individuals that are symptomatic. That was kind of the first tranche. And then supporting congregate settings to carry out mass testing, point prevalence and Sentinel testing for at-risk and vulnerable populations, helping communities, and it's another part of the state's broader testing plan. And then, I would just tell you in the last several months, being able to adapt to changing testing needs and capabilities has really been, for sure, there's been just so many changes in kind of testing plans and that kind of thing that, we've had to definitely be flexible and adapt. So those are some broader strategies at a state level from the Department of Health. And if you want to go to the next slide. So we're going to talk about the types of testing that, again, I'll talk about these types of testing and then how we've supported that for congregate settings up to this point. So our initial rollout of testing and helping facilitate testing with the congregate settings that I mentioned started with mass testing. And so mass testing targets testing a large number of individuals in a short time. And you're really, in this strategy, in this testing strategy, you're looking for the prevalence of COVID in certain populations. What I would tell you about mass testing is that as that rolled out and as we started to support mass testing and help facilities across the state that serve special populations roll that out, that really involved kind of a variety of how those tests were applied or kind of what populations were targeted. So by and large, most facilities that opted to participate in mass testing tested, offered up testing to all residents and all staff at the facilities. As we'll talk about just kind of through the testing processes itself, we've got a couple of facilities that serve children, others that serve adults, and so, testing is not something we can obviously require or would be required, but certainly is something that we've been working to support. Once we kind of worked through some of the challenges that we'll talk about here around mass testing, we then moved into and have moved into over the last few months into Sentinel surveillance testing. And so here, kind of the idea behind Sentinel surveillance testing is that you're testing kind of a random sample of asymptomatic individuals. And again, in the facilities that we've been working with, they're testing a random sample of staff and residents. And then you're obviously screening to kind of look for that prevalence of COVID, and then both with any type of testing, then of course once we, to the degree that we have positive results, then working to, isolate those individuals from the rest of the population and support agencies with their plans for how to do that. And then the last type of testing is, sometimes during either mass testing or during Sentinel testing, we may have either a high-risk exposure or kind of a higher number of exposure. And point prevalence testing is just a strategy that might take I'll give you an example. We had a unit within a facility that was seeing some positives as a result of their Sentinel testing efforts. That led to them doing a broader testing approach when they, and moving into a point prevalence testing where they really just tested, rather than doing a sample on that unit, they then moved into testing the whole unit itself to try to kind of screen and kind of understand prevalence within, within that facility. Some of the lessons learned here, and we'll talk about that, our partner agencies, our behavioral health providers, community support, psychiatric residential, whatever those may be, they really have stepped up and implemented some processes. They've had to make some process changes to kind of make this work. What I would tell you broadly about how the testing effort works with the Department of Health is that the South Dakota Department of Health does have funding to pay for the test kit and the analysis of the kit of the test results itself. What the facilities had to provide then would be the appropriate, nurse or other trained staff to actually do the specimen collection. What is maybe unique compared to some of the shelters that may, again, just kind of be a little bit different in terms of structure. Many of these facilities already have because of the nature of the services that they provide, already had on-staff nurses that were able to be trained to do specimen collection. They had to be fit tested, and, it's not, there are processes to work through. But I would tell you, once that got in place through mass testing, then the Sentinel and point prevalence and some of the other things flowed pretty smoothly. I would tell you that we have a couple of very remote facilities that did not have that capability, and so they partnered with local healthcare providers or local entities to kind of support getting that specimen collection. So those were some, supports that needed to be in place to facilitate testing. So if you want to go to the next slide, Davis. Again, and now, I kind of covered this already, but again, this is just a little bit more detail about that Sentinel surveillance testing. And so, again, you're doing that random sample. You're trying to ensure and kind of screen out positives as soon as possible and do that contact tracing and kind of minimize future, exposure. And again here, just like mass testing, we offered up, and this was a presentation from earlier in the year, so I've tried to kind of modify it, but at this point in time, we were working with these facilities to kind of move into Sentinel testing. And again, there's kind of a lab kit process and a Department of Health process that kind of makes this all work. So you can go to the next slide. You know, in terms of Sentinel surveillance testing, there's some guidelines around this. Recommendation is that you would test up to 5% of your residents and our staff that are asymptomatic. And we actually should revise this. We had planned to test through the fall. We're continuing to do Sentinel testing now through the winter, just based on where we're at, obviously, with our COVID response and kind of COVID situation. You know, and then there's some, obviously, you don't want to select the same staff and the same residents. You're really trying to get a broader spectrum. And I would just tell you that as we talk about these different types of testing, there's not a prerequisite, you know, and there's not, at this point in the response, mass testing, Sentinel testing. If we've got folks in other settings, including some of the folks on the call today here that are interested, you know, we're at a little bit different point now where we've got a little more flexibility with how we can kind of roll this out from where we were this past summer. So if you want to go to the next slide. You know, some of these then now kind of just get into some details, I guess, if you will, around kind of how the process works. I don't think we need to kind of, you know, there is just to give you an idea, whether it's mass testing or Sentinel testing, you know, essentially, you know, you've got to get those specimen collections lined up. You've got to get consent from the participants. In some cases with children, you know, there has to be a medical order for testing, and typically local providers have done that. And then what happens then is as the tests are collected and results come in, our agency points of contact that work in the different state agencies I mentioned are receiving those results so that we can track aggregate test results and report those back up through the Department of Health. So I think you can go to the next slide. This was a registration form that we used. So again, today we're trying to introduce the topic, give you a flavor of some of the processes. This would be something we would talk about in the future to the degree that if we've got some agencies interested in moving forward with, you know, any of the types of testing that we've talked about. So I think we can move past that, Davis, just kind of giving folks an idea. And again, this is an older presentation, but you'll see here, these were our agency points of contact that, you know, that really have been the key leaders in facilitating for the different groups, the testing processes. And so Davis and or Denise would likely be points of contact then for any shelters or other folks that don't fall in one of these other groups that are on the call today. If you want to go to the next slide. This is just actually as of a couple weeks ago. So just kind of some results relative to what we've seen so far. Most of our mass testing wrapped up in the summer. Again, there's still some opportunities there. But you'll see there that across the facilities that opted in, we tested over 1,800 individuals, 26 positives, and you know, I think we were pleased, relatively speaking, a pretty low positivity, you know, a lower, you know, under 1.5% positive. Under the Sentinel surveillance testing, that work started in September rather. We've got about 24 providers that opted in, and through the end of November, the results that we had, we did about just over 400 tests, 13 total positives, with a positivity rate of just over 3%. And then, you know, kind of this other piece I wanted to cover and just have there be awareness around is that, you know, again, as things have changed and evolved with testing over the last several months, there's really a new, it's a type of test. And essentially what rapid testing does is that it's targeted to individuals that are symptomatic. So this wouldn't be something that you would use to screen people that are not showing symptoms. This would be, you know, in the worlds that you work in, if you get an individual, they're admitted or at your facility, and they start showing symptoms, rapid testing, which does take some other steps and other processes, is a way to just get quicker results, essentially, with the idea that you're going to, you know, try to get those people, get folks isolated and, appropriately screened. So I think you can go to the next slide. And I think with that, those are the types of tests and the types of activities that have been underway. Today, I think our goal was, and then we'll open it up for questions here, but I think our goal today was really just to introduce it, have there be awareness and kind of understanding of the types of testing, what some of the high level, what some of the processes are. I would tell you that as we've worked with the different facilities across the state, we had some early adopters that kind of jumped into testing right away. We had others that kind of came on later. I would just tell you that we've got a team of folks ready to support facilities. Certainly recognize both our domestic violence shelters and our homeless shelters. Oftentimes, given the maybe short nature of the stay and those types of things, there's some other considerations as facilities think about testing. Some of the other facilities that I mentioned, residents are there long-term or longer-term, 8 to 10 plus months, so that's a little bit different situation, but these are things that we wanted to just make aware to your group. I would say I'll open it up for questions, and then, just the offer that if there are facilities or shelters that are interested, we can work through Davis and Denise and support those efforts to kind of advance those forward. So with that, and I'm actually going to stop and see, Caitlin or Rebecca, is there anything else that you two would maybe want to add that I missed?
No, I think it's Caitlin, and I think you covered it very well. So just whatever we can do to support these settings and answer questions.
This is Davis, and for all of our partner agencies on the conference call, please think, if you have a question, please make sure and ask that. I guess I would have a question, and that would be, if an agency would like to move forward on trying, to work with you folks on developing a testing plan, how would you like them to proceed as far as making contact and that sort of thing?
Yeah, thanks for that. I think the best approach, I think, would be, Davis, since you and Denise are obviously very familiar with most of the folks on the call here, I think if we could work through you guys as kind of the points of contact for this group, folks can contact you, and then as part of our group work that you've joined, then you can kind of pass that on to our team, and then we can start a plan for how we could move that forward.
Okay, so we can work with this group and then communicate with you guys via the work group that we have begun to be involved in.
Yeah.
No, that sounds great, Brenda. Is there anyone on the call that has questions for Brenda and her team, or the team that's on while we have them? This is a great opportunity.
So
go ahead.
Sorry, Brenda, we had the same thought. This is Caitlin again. I'll just chime in that, to best understand how to support you guys with testing, I'm sure that there's quite a bit of difference in between each setting, but that's not the only support we can offer. So also we've done some technical assistance with places just in getting good mitigation measures in place, good infection control practices, ways to modify your environment and promote healthy habits. So if there are concerns or specific situations that we can help work through, sometimes we can gather some expertise from nurses or people who are infection preventionists by background and get some of that support too.
That is great. Thank you for that too. I guess I would have another question if that's okay, and that would be, we have folks that work in situations that we describe it as street outreach. Is that another area, talking about special populations and homeless? And I know we talked about you guys mentioned unsheltered, and is that an area where you guys see it feasible to develop a testing plan to target especially unsheltered people out in communities? Is that a situation that you guys have encountered up to date, doing testing that way?
So Caitlin, I'll chime in. I think that's an area that we haven't as a group focused on, or really, again, we've got kind of more, setting based. But I would say that, to the degree that facilities are able to, I think there's a lot of information we can continue to provide. That as part of that outreach, referring people to where they can go get tested, how they can get tested, and then, if there is a facility that they're affiliated with or receive services with, understanding, if that facility is participating in testing, how to link there. Anything else there, Caitlin or Rebecca, to add there?
Yeah, I would just agree that that's one of the challenges we're kind of looking to you guys to help us understand how we best address, because I don't personally have a lot of experience with that, and it will pose some challenges with the testing aspect as far as, generally a specimen that's collected and then sent to the lab takes a couple of days to result. So how do you get that information back to that person? How do they take the appropriate steps if they're unsheltered in between specimen collection and results? And then there are some intricacies also around if you were going to use a rapid test option, how that would be administered in that kind of an environment, I guess. So it would be good, I think, to understand what some of those challenges are. Like if these strike teams or street outreach teams have multiple consecutive days where they have contact with a person, or how that works. So it's good to get the conversation started, I think.
Yep, and I appreciate that, and I also can, from a layperson's terms, see some of the difficulties in undertaking something like that. So I appreciate you having that conversation with us. Is there anyone from the consortium with a question?
Davis?
Yes.
This is Melanie Zamora.
Hold on.
Melanie Zamora?
Can you hear me now?
Yep, much better. Go ahead. Oh, you might be paused now, Melanie. Or muted, excuse me.
Still muted, Melanie.
Can you hear me now?
Yep.
Yes.
Hello?
Yep, go ahead, Melanie.
My gosh, sorry about that, you guys.
Okay.
So I'm from the disaster response PA team, and this has been really, really interesting to hear this presentation on testing. So I'm not from the consortium, obviously, but I thought I would jump in here. So I wonder about how this really robust and well thought out testing strategy and testing planning has led to you all hearing about outbreaks within the shelter system. So I hope somebody could just talk about that for a second. And then also this conversation about the unsheltered populations, I think, is very timely as the country will start moving toward vaccine strategies and how to stay connected with unsheltered populations if there is a 2-dose round with 3 weeks, between the doses. I think it's just so timely that you all are thinking about reaching out and getting connected to unsheltered or very, very transient populations. So I want to say the HUD TA team is going to be here to support that effort, but also just say good job in thinking about that. So my question here is about any outbreaks that the testing strategies have uncovered, and then really what has happened since the outbreaks were uncovered.
Thanks for that. So yeah, I'll talk about, so again, at least with the congregate settings that have participated in testing up to this point, which again, so far has been our community support providers, behavioral health, and again, most of these are, you know, kind of a residential setting with special populations. You know, I would tell you, when we did this presentation earlier this summer, part of the lessons learned, part of the presentation was having those providers share their lessons learned. And, you know, I would tell you, you know, we had some folks that I think were maybe a little hesitant initially around testing for a variety of reasons, lots of different things that contributed to that. But we did have, you know, more than one facility that then, you know, had started to see some positive cases. And, you know, I think what that has done is, you know, having the testing in place to be able to screen, whether that was mass testing, Sentinel testing, or point prevalence testing, doing a little bit deeper dive. You know, those facilities have really had to have good plans in place around isolation, quarantining for close contacts. And so, you know, I think they would share with you that, you know, it's given them kind of, again, an effective tool to try to slow the spread. You know, in some cases, you know, again, you know, maybe some of that Sentinel testing revealed some positives, and then that led to broader testing that then really uncovered quite a few asymptomatic positives that then could be separated from the population and, again, kind of stop the spread. So, you know, we can, you know, again, I think we've just heard a lot from our providers about, you know, the value it's brought for them. In terms of, again, just kind of screening and managing you know, screening and managing within their facilities.
Great, thank you for that, Brenda.
And this is Denise. So Brenda, I just want to confirm kind of for everybody on the call too that you guys haven't, your team to date, worked with any of the homeless shelters or bigger emergency shelters to do any kind of bigger testing event or anything to date so far. Is that correct?
We have worked with one or two providers or settings that are domestic violence shelters, and that's the closest kind of similarity I could draw, just based on kind of an emergency shelter situation, and then also the short stay amount of time that they experience, and also just with that group, a heightened need for privacy and confidentiality around information.
Sure. So, okay, thank you.
Mm-hmm.
Hey, this is Ashley. Just one quick other question. This speaks a little bit to, Davis, your comment about sort of street outreach and going out into unsheltered populations. Do you all have any sort of, forgive me if you already said this, a mobile van testing? Is that even a possibility? Because I know you were saying you actually have to get, you know, to get it back to the lab and all of those things. What about sort of mobile van testing?
Well, this is Brenda. I'm not aware. I would just tell you within our group, in our facilities, and again, I think probably because to date, the folks that we've been working with are, you know, kind of residential. Those folks are in these facilities, depending on the service type, anywhere from 30 days up to 12 months, you know, concurrently. So, you know, I don't think, you know, our group, but I don't know, Caitlin, across just generally, if you're aware of any kind of mobile testing, not necessarily targeted towards any certain population, but just availability of that in any communities.
I have to admit I was looking at an email for some of that, but the only testing solution that I am familiar with that's a rapid test that has that kind of mobility is the Binax now. It's a saliva card. And we do have those for distribution, so if there's interest, we would just have to figure out the logistics of, really it's some laboratory waiver stuff because it's performing a laboratory test outside of a laboratory, essentially. So just making sure everything's in place for that.
Hi, thank you so much for your presentation. This is very informative. I'm interested in the conversation about progressing to testing those that are unsheltered and those in homeless shelters. Has there been any discussion on what the isolation plan might be for those individuals, or would that be up to whichever agency was providing that testing?
Rebecca, if you're on, do you want to talk a little bit about that piece?
Yes, hi. Can you repeat the question, please?
Sure. I was asking about as the testing capabilities increase and start moving to homeless shelters, if interested, or even unsheltered, as we were discussing earlier, what the follow-up piece would be for if somebody were to be positive.
Okay, so in need of quarantine and isolation then, is that what I understand?
Yes, ma'am. Sorry.
Okay, that's all right. I'm sorry. I thank you for clarifying. We have a quarantine and isolation program that we've developed through the state. I'll be very honest, the homeless population has been challenging. Luckily, the major areas in which we've had to work with this has been in our more urban centers, Sioux Falls and Rapid City. So right now, the current process is if we have identified a patient who is in need of isolation and has tested COVID positive, or if they have been in close contact and are in need of quarantine in Sioux Falls, and you may already be aware of this, we work with our contact with the city of Sioux Falls, and they have set up a recovery center, is what they call it. And so the process would be that it would go through our disease investigation process. They would enter our system, and then we would refer them to the recovery center here in Sioux Falls. In Rapid City and Pennington County, we work directly with the Pennington County emergency managers, Alexa White and Dustin Willett, if we have a person of the homeless population that needs to be quarantined or has tested positive and will need isolation. Other communities throughout the
Excuse
state.
me.
Yes.
I apologize for interrupting. This is Annie from Great Plains Tribal Leaders Health Board. So in regards to isolation for people in Rapid City, that contact is not with Dustin and Alexa. That Great Plains Tribal Leaders Health Board has been leading the isolation center in Rapid City.
For the entire city?
Yes, actually,
and
it started out that we were identifying people that were homeless and COVID positive, but we've accepted other folks in there regardless of their housing status. And then we work with wraparound services with VOA. and other community partners.
And I don't know if we have Gail on the line. I know our internal protocol is to go directly to the emergency manager, so they may be contacting you, and then it is then not on our, and then they take care of it, and it's not on. We release them for services through them, so they might be redirecting them to you. It's very possible.
No,
that's not happening. Okay.
No, because there's a challenge with the funding in regards to FEMA, because if Pennington County had opened up the isolation center, then there'd be opportunities for FEMA dollars to go toward it, but that's not happening.
Because they did have an isolation center for a while, and then that was, again, we worked through the emergency managers. So that shut down, and since then, I know that Gail, our housing specialist, has still been in contact working with the emergency management, and any case, and I don't know that she's had a lot recently, any case that she has gotten, I know that she refers them to Alexa and Dustin. So maybe it would be great to connect and connect Gail with
We've spoken.
Okay.
So I am the emergency manager for Great Plains Tribal Leaders Health Board Emergency Operations Center.
Okay.
And we have had many conversations with Gail. Gail's talked to Oyate Health Center on many different occasions.
Yeah. Yes,
we actually set this up because there was no other opportunities through the state or Pennington County to meet the needs of people at the time. It was set up October 23rd.
With Oyate?
With Great Plains Tribal Leaders Health Board leading it, yes.
So is Gail referring directly to you then?
So this might be a good conversation to kind of devote its own time to. Do you think?
Well, even if I just knew if Gail was contacting you directly, then I can follow up with her and we can update the plan. Is that correct? Has Gail been sending referrals through Great Plains Tribal?
I don't know. I can't tell you that for sure.
Okay. All right. Well, I will connect with her then after this call, and just to verify how that, what her connection there is.
Again, who am I speaking? Who's speaking right now?
My name is Rebecca Baird. I'm with the Department of Health.
Okay, Rebecca. I will try to get your email and send you mine.
Perfect. Sounds great.
That sounds great. Are there additional questions? This is good. Hopefully we can get, open up the communication. And if we, through our office too, can be a help with any of that, please don't hesitate. Either any of the groups on the call, please don't hesitate to reach out to us too, to be a go-between and communicating and that kind of thing, or to help with that, or to share contact information or that sort of thing. I mean, we're very much able to do that and help. So, and if folks, as they go back to their agencies in the coming days and have these conversations, regardless of what part of the homelessness response part you're working in, and you have additional questions or comments, or would like to get involved, or would like to set up testing or anything else, we can act as a go-between too and try to make sure people are able to communicate. So don't hesitate to email Davis or Denise, I think, and we'll move forward. We'll help you guys with that to get started.
Thank you so much for having us today.
Thank you. Thank you so much for your time and effort and all the expertise, and we really very much appreciate it.
Sure. Enjoy the rest of your meeting. Thanks.
Thank you.
Thanks, Caitlin. And this is Denise too. I just wanted to say, I don't know if we have some people that have called in and aren't on through Skype, but Brenda had posted a message to you that she had to get off for another meeting. But, any questions or anything that you guys have, please send those to Davis and I, and we'll then work with that work group to figure out a contact and get the conversation started between your congregate shelters, maybe some of your street outreach programs, really starting that conversation, because I think one of the important things that came out of the information they just gave us is really getting that connection to some of our emergency shelter and homeless shelter settings to get some testing done and really work with your agencies to do that. So please feel free to reach out to myself and Davis, and we'll get that conversation started with them for you.
Yep. Excellent. Thank you. Thank you for taking the time. And I see there is a question in the chat. Has non-congregate shelter been set up to shield high-risk people experiencing homelessness? And I guess I can't speak for, I know there's several people from the actual projects on the phone, on the call, but I know in certain areas, that is occurring, but I think it's a challenge and something we're looking at, even with coordinated entry, trying to think about, looking at the sort of risk factors and trying to think about referrals, including that as well. And so I guess the answer is, I'm sure we can do a better job. So we're working towards that, but, and I know in certain communities it's occurring more often maybe than others, but it's definitely a concern we have. It's the high risk folks.
Yeah, Melanie, and I think to go a little bit, so in Sioux Falls, the city of Sioux Falls, as they mentioned earlier, has set up a recovery center where they're utilizing rooms that they're able to put COVID positive patients into for isolation and quarantine. We also have on the other side of the state, Volunteers of America Northern Rockies. They have some of our ESG CV funding that they're utilizing also for motel rooms to house people that can't get into shelter or aren't eligible to go into shelter or have some other, reasons that they need to not be in congregate shelter. And, throughout our state, any of our ESG funded agencies have the availability through their shelter funding to be able to provide motel space, motel rooms to either decompress their shelters if they need to isolate and quarantine COVID positive patients. So they do have the funding available for that and other communities throughout our state also.
Good question. Are there other additional questions? And I know Ashley Kerr had also offered some comments. I don't know if Jill is on or not, but we do have our TA folks that are on too, and maybe some of their team that are sure welcome to contribute to, or if you guys have additional questions, or if you feel like there's a conversation we should be addressing, or anything that, based on the sort of HUD best practices. Is there any input that you guys additional have for us, the TA folks?
This is Melanie Zamora. I'll say quickly, and then I have to jump off for a call. We are paying close attention to several primarily rural states across the country, South Dakota being one of them. And we want to offer our support and our guidance. And at this point, we have worked with so many communities across the country. So we have some really good lessons learned and all of that. So Ashley and I are actually working together from a disaster and a financial planning standpoint. And we're working closely with Jill to make sure that states, including South Dakota, have all the support we can offer and what you need and what is helpful. So we're here for you, and we'll circle back for more conversations.
That's great. Thank you, Melanie and Ashley. And you guys are all of our partners out there. Keep that in mind too, that we do have access to a number of different resources in order to address these issues with COVID. So certainly as the vaccine situation comes about too, I know from conversations we've had in the Department of Health and that sort of thing that, this initial vaccination, the first is really going to be limited essentially to folks that are working, in the hospital system, because I believe the entire amount was around less than 8,000 doses. So, but we are anticipating, this obviously will become larger, and we want to be advocating for our folks that are experiencing homelessness, and that's our intention. And so I think we have a good avenue to do that with this work group that we're a part of. And so we want your guys' input, and please reach out to us too, to help with that, and so we can facilitate if we need to do additional testing, and then as the vaccine rolls out. So please keep that in mind.
Hi, Davis. It's Jill.
Hi, Jill.
Hey, just a couple of quick things. I know that our time is quickly gone by the way, but we'd love to be able to join you at future meetings. But before we leave, Ashley and Melanie may have already hopped off, but I did want to just refer everyone to the South Dakota plan for vaccinations. We wanted to just ask a few questions and bring to everyone's attention today that there is actually an official plan for rolling out the vaccine. We know it's going to take time, but we also are very aware that the people experiencing homelessness should be prioritized, and it looks like in South Dakota they will be prioritized. So we really just wanted to bring before you the plan and make sure you were aware of it. And I did post it in the chat earlier. If you want to look at the plan and see a little bit, it's kind of long. I think it's like 65 pages. But it's important for us to start talking as a community about how we might consider vaccinating people experiencing homelessness. And I think today, because we really don't have much time, I just wanted to see if there were any concerns or questions that we could talk about, or if you wanted to share those with us, we can get back with you at a later point. But we, as Melanie said, we do want to be here to support you and help you during this incredibly challenging time. And we know we're moving into another challenge with the vaccine protocols and how people will receive that. So just want to open the floor for just a couple of minutes to see if there's any questions that we might be able to answer or any concerns that you might have. Okay, well, we do know that your meeting, you've got other things you need to attend to today, so please feel free to reach out. Davis or Denise can get in touch with us, and we're happy to chit-chat further about the vaccine protocols and how that's going to roll out to people experiencing homelessness in South Dakota.
Excellent. Thank you for your assistance, Jill. We appreciate it.
Certainly.
Okay. Well, keep that in mind, please. Please think about questions. Please go back to your organizations and discuss these things. I don't know if we can stress enough how important it all is. I'm going to go ahead, in the spirit of things, keep things moving. I wanted to mention the tremendous effort is occurring right now involving South Dakota Cares Housing Assistance Program. Just got the updated information from Lorraine today that there's now 3,400 South Dakota households in the queue, either going through the process or enrolled or working through different things. So if you imagine, that's a tremendous amount of people potentially being served. There was $10 million allocated for this effort. The assistance is directly related to economic losses occurring with COVID-19, and it's just the items are listed right there. It's for rental, mortgage, and utility assistance. The key point at this hour is that the application deadline is the 18th, so keep that in mind. with that, there's been an absolute tremendous amount of work going on with that. If you can imagine rolling out that program, trying to help 3,400 households in a very short period of time. These are the partner agencies. Hopefully I've gotten everybody on here, but tremendous amount of work. It's a lot of extra work for people. Just wanted to recognize the efforts we know that are going on. I think, to be honest, there's folks that would be at our meeting participating today, but they're probably, some of them I'm sure are assisting folks right now, or they would be here. So here's a list. You can see it's statewide, all the different agencies. And we just really appreciate all the hard work and efforts that's gone into this, not only from the agencies, but from the staff. Does anybody have any questions or comments about it? So a tremendous, tremendous program doing a significant amount of good within the state. Okay, I think we should probably keep moving then. Let's jump into our next topic, our next agenda item, 2021 PIC count. We've scheduled our date for that. I have a number of slides here. Some of these I think we'll go through, rather quickly. We have a committee meeting. Please keep in mind that anybody would like to join on that. They can just send to me an email. We've had really, really good participation going back to July in that meeting. You can see we've established our count date. It's a tremendous wide effort, as you can probably imagine. It usually involves hundreds of volunteers and agencies. I'm just going to do some sort of review, just because I know we always, in our meetings, we always have folks that just a lot of different experiences across the board, from folks that have been involved with this sort of activities for many years to folks that each meeting we have, I think we have some people, it's their first meeting. And so that's just part of the situation we have. So we try to explain processes at least a little bit. But so the point in time count is essentially a homeless surveys and the housing inventory chart. The count has two parts: a sheltered count and an unsheltered count. The sheltered count is essentially for folks in emergency shelters and transitional housing for homeless. And the unsheltered count is just what it sounds like. It's the folks that are on the streets, that are living in places not meant for human habitation, in their vehicles, camping out in January, that sort of thing. People ask, many times they've asked me, why do you do the count? I worked up these slides because of that. This is directly from HUD. They had shared some information to help us to explain that to different people. The count measures and monitors trends and changes, really, right within communities or within our state and also on the national level. This is a report. All the information that we compile and put together in South Dakota goes into a report which goes to Congress, which becomes a part of the national report. Helps us to look and see what resources we may need, how to best use them. For instance, geographically, where the homeless folks are, do we need to try to work in order to allocate resources to different places? I think some of this data currently, for example, with our ESG CV planning, moving forward, part of what Ashley that was on the phone just a little bit ago and Jill have been helping us to do with some other agency folks and technical assistance is to use this data to see what parts of the state really need to have resources allocated more to them geographically and that sort of thing. So that's an example of how this data is used. It's also part of the federal requirements for the continuum of care funding. And it's important to remember with the point in time count that, what we're counting are folks that are described as literally homeless by the U.S. Department of Housing and Urban Development. It's a very strict definition. We understand that. It creates, generally we'll create conversation about that, in which we understand different federal programs may have different definitions for homeless. That's something that comes up a lot, but for our situation, this is the definition that we need to use. So folks in a shelter, folks sleeping places that aren't meant for human habitation, folks exiting institutions, as long as it coincides with these, these stipulations, And then folks, all people that are attempting to flee domestic violence or human trafficking, that lack resources to obtain other permanent housing are considered homeless as well. Another question people ask a lot is, why do we do this the last 10 days of January? And HUD's response to that was these answers as well. The same time of year gives us consistency in order to sort of monitor trends, which makes sense, and also that folks are more likely to have maximized their resources this time of year. Emergency shelter, people are likely to seek emergency shelter, be in the shelters, other assistance, during the time of year. Also, public benefits are likely exhausted at the end of the month, which makes a lot of sense. There's always further information at the HUD exchange. And again, this is kind of a quick review. I understand that. Does anybody have any questions about these slides, as sort of the overview? Okay. So we kind of went over this. Who do we count in the count? Right? Folks in emergency shelters. We know there's going to be a significant amount of people in a what we call a hotel voucher situation, right? And they sort of alluded to that in some of our talking about quarantining and isolating, and then also it's just a number of programs across the state will provide that as an emergency shelter. We just described that as hotel vouchers. And also transitional housing, talked about unsheltered, folks sleeping in their car, in a park, abandoned buildings, campgrounds, etc. This is just a quick comparison the last couple of years, just some numbers to sort of see. Last year we did count additional folks as homeless. This year there's, with COVID-19, there's going to be some challenges with counting. We know that. We also know that there's, been a significant economic impact to a lot of people. We see that with the 3,400, right, households that applied for assistance. Just for that, that's just one example. So we anticipate we're going to count, a significant amount of people as experiencing homelessness. Some quick information on the point-in-time count involves domestic violence agencies. We always have really good representation in our quarterly meetings from the domestic violence agencies in the state. I'm going to be doing some training videos. I'm going to do a specific training video for the DV agencies. We'll be sending that out, a link to that. In the past, I just worked directly with the DV agencies in order to complete these activities, and we do that for confidentiality and to ensure safety. So we obtain all the data on that directly with the agencies. We use a spreadsheet that doesn't include any data that can be disclosed who people are and that kind of thing. But I'll go through that in the training specifically. So we have different forms we used for the housing inventory chart. That's where we chart all the different organizations that are serving homeless people or formerly homeless. It's part of the process of the point-in-time count. We use a mobile application for our count. The desktop version is very likely what most agencies will use for their counts, non-domestic violence agencies. And that's available at that website, www.countinghus. That's the desktop version. There's also a mobile application version that you can use for a cell phone, which is smartphone, which is handy for folks, working in the field, especially for unsheltered people. Organizationally for our PIC count, we divide the state into these regions and cities, and we have VA staff leads as well. So we greatly appreciate the help we get from these guys. In Rapid City in Region 1, as you can see, Sarah Hornick from VOA. In Region 2, Becky Hatch from Grove, South Dakota. We have Darcy B. down in Rocks in Region 3. In Region 4, Arlene Weirheim, who's very likely working. I know she's been diligently working on the CARES Act. She's one of those folks I know that's been super hard on that. Susan Smith from Augustana University for Sioux Falls is our lead there, and the VA staff, Christy Anderson Jameson Hill and Heather Rystrom. So those are the folks in your particular areas that are your go-to people for training and assistance and help and guidance. You can always reach out to me. Are there any of the regional city or coordinators that would like to mention anything or make any comments? Sure can. So with COVID-19, obviously, things are a little different maybe they have been in the past. That's for sure. We're going to stress safety. We've made some decisions through the PAC to mitigate risk. One of those being that we will have a shortened survey for the unsheltered count. We're going to ask a few less questions in order to shorten the survey time, shorten the amount of interaction with people, especially for safety. The sheltered counts with the homeless shelters and the hotel vouchered people and the transitional, that will be much the same basically as it's been in the past. So this is just some information on our mobile app. Folks do have the option to use our paper surveys, and we realize some folks are going to do that. It's acceptable, right? But we really want to support people using the mobile app. This is set up information for that. Like I said, you can do, like for an agency, a project, say a homeless shelter, you can download the app right to your desktop computer and enter the data right there. So from an efficiency standpoint, we really encourage agencies to do that, to just use a computer to enter the data one time into the app via their desktop. Right now the count is in test mode, so you can go in anytime you would like and do some practice surveys. So it's all ready to go. This is a website there at the bottom that will give you some additional resources. And again, that's the website for the application for a desktop version at the bottom. So this is just some quick slides on downloading the app. In the past years, we've spent a lot of time on this during this call, but I think this year we'll move through it rather quickly. But you can see that these are the steps you follow for downloading this to a smartphone. And it's the same for your computer, other than you just go to a different website in order for your desktop. So as you can see, it's relatively easy, and there's step-by-step instructions. And I have instructions that are just on one sheet of paper as well. I put these on individual slides, but that's the setup and test key, South Dakota 2021, joint count. Boom, you're in the count. Okay. Any questions or comments about that? I think one of the issues we've settled on as a committee and discussed with the PAC2 is, the need when we're working with folks for the point in time count is to make sure, the issue is where folks are sleeping on January 26th, Tuesday, January. That's the count date. So we are going to count a little, do a 7-day unsheltered count essentially, with the stipulation that we just really need to determine where people slept on Tuesday, January 26th, and that's a HUD guideline. That's what they're looking at. That's why they call it the point in time count, because it's a snapshot of time, 1 day in time. If that makes sense. That's what we're really trying to measure. As far as the unsheltered observation tally, that's something that we try to discourage to be used, only to be used like in situations where it's just required, like because of, for instance, someone's sleeping or you can't communicate with them, perhaps could be like intoxication or something like that, or it's just not safe, or other than that, it's just so hard to deduplicate, and we're required to be able to deduplicate surveys. We only want to survey people one time, so it's really hard to do with the observation tally, and the observation tally just doesn't gather a lot of data, and not only that, but the observations people are making are really subjective. We really prefer that people are asked the questions. They need to be asked those questions directly. We want them to answer. We struggle with having volunteers just subjectively decide people's race and even their gender or ethnicity, and those are the types of things people just decide, without asking someone. We don't want that. If that makes sense. Again, this is the mobile application for SimTech resources in order to get more information. We're meeting as a committee. There'll be some training videos coming out. I've completed the first training video, which is on the housing inventory chart, and we'll get those links up to people very soon. Please practice surveys. Please, if you are an agency, get in the app and practice the survey. Make sure you can find your agency in the project, and that we can ensure that folks are, by practicing, our practice site is set up just like the live site. So all the agencies are listed in there. Like if, say, you work at ABC Shelter, please, for instance, please go into the practice site and make sure your shelter is listed properly, that you can find where to enter folks. And we talked about the HUD guidance on the unsheltered. We're going to use a few less questions in order to sort of shorten the amount of time people are surveyed. We're going to count for a longer period of time, and there'll be a training video on that as well coming out. All right. Any questions on the point-in-time count or housing inventory chart? A lot of information. I just wanted to do an overview today. There'll be a lot more information coming out soon. We'll be contacting the domestic violence shelters individually, providing some training materials, working with them directly, complete the count, and the regional and city leads are reaching out to all the agencies in their areas, getting people prepared for the count as well. We understand that, honestly, volunteers' situation might be a lot different this year. Stands to reason due to COVID-19. So that might be an issue. We'll try to adjust our can to address. We plan to provide PPE to volunteers, to people in agencies, and I think our plan is to distribute that through the regional and city leads as well. So we'll have some face masks and hand sanitizer and that kind of thing that we'll send out to share with people too. Any questions? It's a lot of information, I realize. Okay, guys are kind of quiet today. Seems like a quiet group, and I know there's a lot going on, so I understand. Okay. No questions on the committee, or excuse me, the point in time. If you would like to join that committee, send me an email. We'll get you to the invites. We're meeting bi-weekly. The next meeting is on the 17th, 2 p.m. Central, I believe. So let me know if you'd like to join that. And I know a lot of communities are having their meetings themselves as well. Okay. With that, let's move on to the next topic. ESG. Denise, are you able to give us a little info?
Hello, everybody. Good afternoon now, I guess, in Central anyway. We're almost at 12:30. So just a couple updates. There'll be more information hopefully soon coming out about the second round. But of course, with ESG, we just have a lot of different pots of money happening right now with ESG. So we have our traditional ESG, our 2019 grant, which expires the end of January. At that time, any funding that agencies have remaining will be recaptured and made available for reallocation. I do send out information, emails, and such to the eligible agencies of how much funding has been recaptured, what funding categories it's eligible in for reallocation. So those communications will be happening. This is also probably a good reminder for agencies to make sure that you're getting your draw requests in, that the expiration date at the end of January will be here before we know it. And then we also, with traditional ESG funding, we have our ESG 20 grant. Those funds were awarded back in September. And so all of our ESG funding, what we do is we put our grant agreements for 18 months so that we do have some time at the end of the grants to do the recapture and reallocation of the funding. We have a 2-year grant with HUD, so we try to give ourselves always 6 months. Sometimes it's a little bit shorter time frame, but so those ESG 20 funds are also out in the communities, and that was awarded to 17 agencies across the state. And that grant will expire February of 2022. And we'll kind of do the same process as what I just explained for 19. At that time, we'll go through if there's funding left and do a recapture and a reallocation process. And then, of course, with our ESG CARES Act funding, which we're referring to as ESG CV funding, our round 1 allocation was almost $2.2 million. That was awarded to 9 agencies across the state back in June. Those agencies, those programs have had some changes, and but for the most part, those agencies are moving those funds and assisting in their communities. We actually have one agency, a draw request I did today, utilized all of their round 1 funding. So their round 1 funding is done. So those agencies, like I said, are running those programs. We've, of course, have, some startup time when we have some new agencies coming onto the program just to learn the ESG program as a whole, and then add on top of that some of the flexibilities and additional components to the CARES Act funding that came about. So it's a learning curve. It always is when we have new agencies, but it's been a great group to work with, and I think we're definitely moving forward with all of those agencies. So I know our round 2 funding is everybody's anxiously awaiting that application. We actually have the draft application is being reviewed right now. So hopefully we can get that application out to the public shortly. We will have, we are allowed to do an abbreviated public comment process. So we'll have a 5-day public comment process when that is ready to be released. And of course, we always make that known through press releases and email information so that everybody across the state is aware that the application is out for public comment and our plan of our funds moving forward. So with our round 2 funding, we do have $5.5 million. We were hoping to have that application. We're still hoping to maybe get it out by the very end of December, but as we all know, our month of December is disappearing very, very quickly. With both of these rounds of funding, we are allowed pre-award costs for any services that are really COVID related. So planning, preparing for, mitigating, anything that's tied to COVID. We are allowed pre-award costs, and we are allowing those pre-award costs back to March 13th of 2020, which is when the governor declared a state of emergency in South Dakota due to coronavirus. So I think a couple other things to keep in mind with our round 2 funding. We are working with our technical assistance team that, as Davis indicated earlier, really looking at our data and our point-in-time counts from across the state. That technical assistance team and the corporate fax team that they work with really dove into those numbers and our and all of our information that we can gain from our HMIS system. They really did look at that and put together a lot of data for us to review, because what HUD wants to make sure is that we're really using some guiding principles with our COVID money, making sure that we're addressing the disproportionate impacts to the homeless population of in communities of color and other vulnerable populations, making sure that we're really engaging those people with lived experience to help kind of create and determine programs across our state, that we're being culturally responsive and really making sure that we're helping those that are most vulnerable and really truly being impacted the worst by COVID. So all of that information and more will definitely be coming out when we release the application and the information that goes along with that application. Thanks, Davis, for going to the next slide. So you can just kind of see with our technical assistance team that they're really working with us to look at the subrecipient capacity, and that is our current subrecipients of traditional ESG. We did have a phone call with our technical assistance team and our current recipients a couple weeks ago that they presented some information to them and, you know, really had some good conversations, because what we really wanted to know from our current subrecipients is what agencies have the capacity maybe to grow within their agency to maybe cover more rural areas or maybe some of the tribal nation areas that we know are underserved across our state. Also looking at just increasing the subrecipients that we have applying for the money. We know that there's some areas of our state where we haven't gotten applications from. So they're really just helping us to provide that information. We'll be working with them to do a pilot project. We're looking at 3 pilot project areas in our state. And again, based on the data and the information that we gathered from our PIT, from our point in time count, our housing inventory chart, our some of our specified reports that we do out of HMIS that are sent into the federal government. We're looking for some pilot project areas of around Cheyenne River, Pine Ridge, and then also around the Pier area that covers Lower Brule and Crow Creek. So information will be coming out on that also. We're looking at doing a $1 million set aside from our round 2 funding for agencies in the tribal nations or agencies that provide services to the tribal lands. So those are things that you can look for once our information is released. And again, that'll all be out for public comment. So we'll be scheduling some time for that too, so that people can get their public comments back into us and after they review all that information. But just to give you some update on kind of where we're at. Like I said, we're in process right now of reviewing the application and the changes. The application is going to look different than what people are used to seeing traditionally with the ESG application. So again, just kind of delving in and making sure that we're asking some of the specific questions that HUD really wants us to make sure to gather and make decisions based upon for the funding. So with that, I'll take any questions or comments. I did post earlier in the comment my email address, so if anybody has any questions related to ESG or ESG-CV, definitely feel free to reach out to me. I'm available for, you know, any of those conversations and happy to talk to any agency that might be thinking about applying or maybe has an idea they want to, you know, just kind of bounce around and discuss. We're happy to do that. So I think that's all I have, Davis. If, like I said, if anybody has questions, feel free to unmute yourself or type them in the chat box or reach out to me.
Substantial amount of funding to be allocated for these efforts.
Yep. Yeah, this is, and if you kind of look at just this page that Davis has up right now, so traditionally our ESG funding is around $600,000 to $650,000 or so, and we got $8 million with the CARES Act funding. So that is a significant amount of funding to South Dakota, and really is hopefully providing us the ability to bring some new subrecipients on or some new agencies. The other thing I should mention, maybe if some people on the call haven't heard that, is the other thing with the ESG funding is that nonprofits, units of local government, and also housing agencies, so housing authorities and redevelopment commissions are eligible to apply for the funding. So that's a little bit of a difference between our traditional ESG and the ESG-CV funding.
Any questions for Denise? Emergency Solutions Grant. Okay, thanks a lot, Denise.
You bet.
Let's see here. We talked about technical assistance. HMIS NOFA report. So just a quick report on this. We've been keeping the pack, I think, up to date as well as we can on that. But just so everybody knows, we're still working on the HMIS NOFA grant. That was a $140,000 grant that we won from HUD over to be used over a 2-year period. Using it for these 3 efforts: data quality improvement, continue to develop the training platform, which will be a series of training videos. Denise, is there anything you'd like to mention about that, the training platform?
No, I don't have much, I guess, additional information. We're definitely in the process of creating it. It is a process. I mean, so we are working with our HMIS vendor, so our training platform will be right in our HMIS system. So current users will go through a training once it's up and ready, and then any new users that come, any new end users that request access to HMIS will have to also go through the training platform. So it'll be a series of questions, and there will be links within the training platform that will take you to some of our HMIS guidance and our HMIS manuals. So questions kind of going back to all of that information also, because those really, our HMIS manual and stuff is really the guiding force behind our database and the requirements of the database. So, what the roles and responsibilities are of kind of people within your organization, and what our roles are as administrators and, people that oversee the database and the program. So, yeah, we're definitely looking forward to it. I think it'll just be nice to have a consistent type of training module that's available. In the meantime, I know any new users that come on, we do have an HMIS 101 webinar that is recorded that really is a thorough overview of the system for new users, so we are using that currently. But yep, it'll be nice to have this right in the system for people.
Awesome. We have, HUD did extend this grant just as a blanket across the country due to COVID for a few months. So we do have about a year left in these grant activities that's funded, so, which is great. And it's the part of this has been, the PAC working through to update all of our documents, and I think Denise kind of talked about that. But so it's rare, we have documents and different things we need to update, and we were actually able to get technical assistance and work through them. And so we've really been able to modernize a lot of our governance documentation for the consortium and for the HMIS, and then the different other documents too. So that was, and then also receive compensation for it. So it's been great for that. Data integration. Been working with the VA, with our different with our vendor, Ecovia Solutions, and then with some TA providers too on that. So that's been an interesting process. Just continue to learn all the time. We have had some successful upload of data for the from the VA, from the HUD VASH program, and we're working on moving forward. There's been some technical issues we're still working out with different things with that, but it seems like we are moving forward all the time. But it seems like it's interesting how what's all been involved now. We're getting on a schedule. We're so thankful for the VA to be assisting us with providing the data on a monthly basis moving forward. So still working out a few issues, but things do seem to be coming together. Another part of this was for staff training, which, as you can imagine, with COVID, kind of threw a wrench in our ability to attend different events and things. So a lot of that's become virtual, which is good, and you still learn. It's a little bit different, sometimes not being in that situation and being able to communicate on that level with different technical advisors, and then people that are going through the same sort of thing in different continuums of care too. It's nice. So it's a little bit more difficult, but we're doing that, and we're hoping that by next fall we could still attend maybe a national training. Yeah. Any questions on HMIS NOFA? or comments? Continue to work on all these activities. We have about 1 more year left in the grant. All right. Well, I think we're going to keep moving forward then. Onto our next item, which is actually going to be the coordinated entry system. I think Stephanie is on. Stephanie, are you able to provide us some information?
I sure am, Davis. Thank you. Can you hear me?
Yeah, I heard you great. Sounds loud and clear.
Okay. Good afternoon. I think I am the last thing standing between all of you and a break. So, so we'll walk through an update of coordinated entry, and I'd like to just provide you with an overview of some of the activities that we've been engaged in coordinated entry over the last few months, and walk through some review of data elements, and we'll have a little bit of time for questions. But as you know, that many of you know, the coordinated entry system is managed through our HMIS system and is our statewide consortium mechanism for ensuring that individuals who are experiencing literal homelessness are have access to both an assessment and prioritized assessment based on their household needs for the type of housing that will be most appropriate for them. And for those agencies and providers that are receiving funding directly from the COC are required to receive their referrals exclusively out of coordinated entry. But we have a lot of partner agencies across the state that are engaged with our case conferencing and engaged in that partnership effort across all regions. And so I know many of you, most of you on the call are very familiar and are active partners in coordinated entry, but if this is your first consortium meeting, that's just a really quick overview for you, and certainly we're available for additional questions that you might have on an individual basis as well. But just to give you an update on where we are as of today, we did update the coordinated entry system with some new data elements that were effective October 1st. There had required data elements in relationship to contacts and events, as well as a triage assessment for households. And we provided a training for all CES end users around the middle of November. And so that was about a month ago that we had our CES end users walk through that process, as well as onboarded some new end users. We have just over 40 end users through partner agencies that are active throughout the state that have direct access to the coordinated entry system. And part of that process was also an update to a physical access point. So Region 1, which includes Rapid City in the western portion of the state, Volunteers of America Northern Rockies is the new physical access point for Region 1. That went into effect on December 1st. And just as a reminder for folks, there are really two ways that households can gain access to coordinated entry. One of them is a physical access point, and the other is a toll-free call-in number that's managed through contract with the Helpline Center. And so those are the two ways that individuals can achieve an assessment. And every region in the state, there are 4 regions, has a physical access point, and of course the call-in number is available to all. So in just the last few weeks, Northern Rockies and Rapid City took over that physical access point for the western portion of the state. We also adopted, and just for you to know that so much of the work under coordinated entry is managed or supported through our internal coordinated entry committee, which is made up of provider agencies and stakeholders. So we have a coordinated entry committee that meets monthly, and then of course any policy or procedure changes also have to be approved by the policy and advisory committee, which is the governance board of the consortium. So we did update participant rights and expectations, as well as a policy and procedure manual, both of which can be found at the website listed here. So those are available for review. And Davis, if you'll advance to the next slide, this might be difficult for you to read from your screen, so it's also available on the website. But one of the things that we found just in our discussions, not just earlier this summer at our annual coordinated entry training, but also just in discussion with you as providers, was that one of the things we wanted to do was continually make sure that households and people who access coordinated entry understand what that means for them, both from a consent standpoint and also what they can expect in relationship to completing an assessment and their housing match. One of the realities that we have, and certainly you all know this, is that we do have some challenges in capacity in our communities across the state. So completing an assessment and going on to coordinated entry does not necessarily for some households result in an automatic referral. And so we want to make sure that people can just manage their expectations that they still need to search for housing solutions outside of coordinated entry, and that it's very important for them to make sure that they keep their contact information up to date. Certainly, one of the things that we've seen since the emergence and launch of coordinated entry is that if individuals do not have consistent and continual contact with a service provider in a community for either case management or support services, that when housing openings occur for referral, that referral occurs through this office, through my position, that it is oftentimes difficult to reach those households or individuals if their contact information isn't up to date, and if we don't have the ability to get in touch with them. So not unlike some of the discussion that you heard earlier today in relationship to things like getting in touch with people for vaccines or testing or those sorts of pieces. I mean, it's those types of mechanisms, and I know that because you all are involved in the day-to-day work, you see this every day, that continual update and contact information is really important in making sure that we can get in touch with households quickly when a housing opening becomes available, so that those agencies that are going to be working with them can get in touch with them. So again, this is just a brief overview of the participant rights piece that we adopted through the CES committee in the PAC. But it is also available for download if you find that this would be helpful to distribute or review with people that you're working with. It's available for your use at the website listed earlier. Davis, you can advance to the next piece. So the last portion that I wanted to spend a little bit of time on with you today, just to begin to review of system performance specifically related to coordinated entry. And the information that I'll be reviewing with you is for a 6-month time frame from June 1st to November 30th. My expectation would be that as we continue to have quarterly consortium meetings, that I will be bringing this information back to you. Again, this was reviewed with our CES committee and also reviewed with the PAC as well. But as a general course, the primary access point for the households served over the last 6 months is by and large the toll-free number. So I mentioned to you earlier that we have physical access points and phone access. About 75% of the households that had an assessment during this time frame across the state did so by calling the toll-free number managed by the helpline. The majority of households that were assessed were scored for either rapid rehousing or permanent housing solutions. And I'll want to begin to advance and show you the next graphs here. I'll talk about that a little bit further. And when we begin to look at the types of, Davis, back up 1 second, if you would, the type of referrals that are generated out of coordinated entry, about 92% of the referrals during this time frame were for rapid rehousing solutions or the equivalent. And then we begin to look at, once a referral is made, where did they go? So essentially, when they're referred for a housing solution, we want to begin to look very closely at what type of housing solutions they're exiting to, because we know that there's a period of time between referral and when people are actually housed. Thank you, Davis. You can move forward. So this first graph is just a review of assessments. So this is all assessments completed within that 6-month time frame. There were 378 assessments completed. You can see at the left side of the screen that a very large portion, again 75% of those, are through the phone. And then I've also broken it out by region here to the side. And when it says region 1, 2, 3, and 4, those are the physical access points by which individuals can also complete an assessment. So they're either completing assessments at a physical access point or through a partner agency that has the ability to complete assessments. So again, by and large, many of those are via phone, but we do see that in other parts of the state, that in those regions, that people are accessing that at physical access points as well. You can go to the next slide. VI Spinat Score. So this is the VI Spinat, for those of you who may not be familiar, is the assessment that individuals complete when they call in and complete an assessment over the phone or at a physical access point. And their scoring dictates the type of housing solution that they are prioritized and referred for. So this graph shows all assessments completed during that time frame. At the bottom, where it says 0 to 3, that's a scoring mechanism where essentially those individuals, if they score between a 0 and a 3, they're not necessarily recommended for housing intervention, and that's a really small percentage of the overall assessments completed. You can see that by and large, those who scored between a 4 and a 7 are going to be matched with a rapid rehousing intervention. And again, this is standardized based on the Spinat assessment. And if they have a score of 8+, then the permanent supportive housing is the solution that they're recommended for. So we wanted to be able to begin to demonstrate to you when people complete an assessment, the type of housing solution that they're going to be recommended for. Next slide. So we've talked about access, we've talked about assessment. I want to spend a little bit of time talking about the referrals that are generated, and this is all inclusive of all regions. Of the 378 assessments, during that same time frame from June to November, we generated 153 referrals out of the coordinated entry system. And by and large, much of those, and I mentioned this at my opening comment, were for a rapid rehousing or an alternative similar solution. So just a quick note about the way this is broken down at the bottom of the screen where it says CE. That is a very small percentage of those, but that stands for coordinated entry referral. Those are the types of housing solutions where for some agencies that have either deposit assistance or a similar funding mechanism, that's how those are categorized. So it's very similar to rapid rehousing, but a separate funding mechanism. And so when you recall talking about assessments, we had about half and half. Half were rapid rehousing, half were permanent housing in terms of their Spinat score. You can see certainly from this graphic that the vast majority of the referrals that were generated during that time were for rapid rehousing or similar solutions. A very small percentage of those were for permanent supportive housing. And so when we begin to talk about capacity and availability in your communities and your local communities about what's available for individuals, obviously there's a difference there that we just need to continue to have a dialogue about. Next slide. And this is the same information, but it's broken out by region. So I just reviewed with you all referrals statewide. This graphic demonstrates where those referrals are by region. So I didn't say this at the beginning, I'm sorry. Region 1 includes Rapid City and West River and the counties in the corridor on the western portion of the state. Region 2, and there's a map or graphic that demonstrates this as well. I don't have it with me today, but Region 2 is kind of the central and northern part of the state. And Region 3 includes the central and southeastern portions of the state and around Yankton and those other counties. And Region 4 includes Sioux Falls and East River. So this is, again, that same information just broken down by region, so you can see a little bit more clearly what's happening in your individual regions. I'm going to go through one more piece and then I'll pause for questions. Davis, you'll advance. I mentioned to you that we were looking at access, we looked at prioritization, gave you some information about the types of referrals that are generated. This information or this data is a demonstration of where people are exiting to. So we know that there's a difference between when a referral is generated and where those exits are. Of those 153 assessment or referrals that were generated, during that same time frame, we had 130 households exit. And Davis, if you'll just advance your mouse, hopefully my graphics work here, because I wanted to talk specifically about, thank you. So if you look at, you can see there's a little bar bracket there. The top 4 tiers or types of housing exits, by and large, lie in rapid rehousing. That second piece where it says 14, that second bar, is for those households that are exiting to family and friends, which according to HUD is a housing solution. Though it's not necessarily one that generates from a referral, it's those households that have found an alternative solution outside of a direct referral to a provider. And the third piece there really walks into rental without subsidy. And then that fourth piece down are those households that are unknown. And so one of the things that's really interesting when we begin to look at this data is once referrals are created, that by and large many of those exits do result in a housing solution. And Davison, if you can advance that. So that arrow there points to when we talk about unknown, and unknown is essentially when we've lost contact with a household or we weren't able to reach them once a housing solution was generated. Again, that refers back to maintaining contact with those households during that time frame. One more piece, Davis. And so if you tabulate all of those together, 83% of the exits post-referral during this time frame resulted in a stable housing solution. And I just want to applaud. I know we talk a lot about some of the challenges that happen with serving households during this time, and certainly you're all seeing that in your day-to-day work, and COVID it has certainly made that work more challenging. I just want to take a moment to applaud all of the work that's happening and also demonstrate to you that households are moving into permanent housing and they're moving into stable housing solution. Do we have more work to do? Absolutely. But I just want to take a moment to really celebrate the success that's happening during this time, because it's a heavy lift for everyone, and I think that's something that as we begin to look into data and begin to make decisions around it, that it's important to recognize that. And also recognize, and this is just a brief anecdote for you, but it's one that I think is really important as we begin to talk about the collaboration that is occurring and has occurred as part of coordinated entry. Now, certainly you all have strong partnerships within your communities and with each other, and that's the strength of what makes coordinated entry work within our communities. Again, I'm sure that we all have ideas and opportunities where we can strengthen those collaborations. But to give an example to you of how case conferencing and coordinated entry has worked well, we had a household that an individual who was living in a very rural community, and an agency that was supporting that household through a hotel stay, and that household in particular had some very specific challenges, and there was a in terms of just service coordination and needing connection to things like vocational training and healthcare and all of the pieces that you see every day. And through that mechanism and through case conferencing and that collaboration, that household was able to move to a different community. It was within the same region, but those two agencies collaborated very well together and very directly with one another to ensure a seamless transition for that individual. And without that type of collaboration, there's no doubt, from my perspective, that that household would have been, that it would have fallen through the cracks. And so I'm not here to say that coordinated entry solved all those problems, because I think that those collaborations are natural for you as partner organizations. I do think it's an example of the great work that can occur through taking the opportunity to talk in case conferencing and taking the opportunity to ensure that those households and those families don't miss those service connections that are so vital. So I know I've talked a lot about data and graphs and those pieces today, but there are certainly some very real and tangible examples of ensuring that people can move into housing solutions in a way that absolutely meets their needs. So I just want to applaud you all for the work that you're doing each day, because I know that it isn't easy. I'm going to pause for a moment. I have one more piece to talk to you about next steps, but I want to pause for just a second and see if there are any questions either about coordinated entry or the data that I've shared up to this point. And you can do that by either unmuting yourself or typing in the chat.
I have a quick question.
Sure, go ahead.
Just kind of curious if there's a waiting list for the coordinated entry program. When she speaks of collaboration, what other opportunities, or perhaps the assessment could still be done, even if the client or the household is on a waiting list for coordinated entry?
So that's a great question. So coordinated entry in and of itself is a mechanism for assessing households for a solution. So it's essentially a prioritization list. And I think one of the things that you brought up is it's something that I didn't mention in the beginning, but is worth absolutely mentioning, is that coordinated entry referrals are prioritized based on assessment score. So it's not a first come, first served list like other wait lists or other mechanisms. It's a way in which to have households assessed to ensure that they don't have to tell their story over and over and over again to be matched with a housing solution. And once someone is assessed and is on the coordinated entry prioritization list, then that's where they will stay essentially until they can move into a housing solution. Or if we lose contact with them for an extended period of time, they may be exited, but it doesn't mean that they can't come back on. So I'm not sure if I've completely answered your question, but an assessment, access to that assessment process is the mechanism to have them prioritized and placed on the prioritization list, where they can be case conferenced and staffed during that time frame with those providers in each region.
That sounds fabulous, and I really appreciate the fact that you bring up the fact that about telling their stories, because the individual in particularly I'm thinking of has been chronically homeless for 6 years, but yes, also a couch surfer. And when you're dealing with a paranoid schizophrenic who's unmedicated and not capable of telling their story or their situation, I think then they fall in that category of the chronic homelessness, because they've never had a single point entry system. So in Sioux Falls, the walk-in or the way for a person to receive the application for the assessment would be through calling 211 or the 800 number.
Are you I'm sorry, where are you are you calling from, Sioux Falls?
Yeah, and I'm speaking of my brother, just so. So I know I didn't want to take up the time, but I just think it's important because he's one of those people that have fallen through the cracks for 6 years.
So in each region, there is a physical access point where people can physically go to complete an assessment if completing it over the phone is not an option for them, or if they need assistance, or if access to a phone or a dedicated phone line is a challenge. In Region 1, Interlake's Community Action is the physical access point, as well as the call-in number, the 1-800 number. So either one of those are opportunities for someone to complete an assessment. And then once that assessment is done, then they're prioritized for support. And Davis just added it to the chat. Thank you, Davis. And you can also access some of the informational flyers and the participant rates and this information on our website as well. But those are the two access options for Region 1. And there's also our region, I didn't mention this in the beginning, but for those of you who are familiar with our access point flyer with the update for Volunteers of America's Region 1 piece, that has also been updated as well. And those are available for distribution. You're welcome to download those or access that. That's why it's on our website. So thank you for that question. Any other questions? Okay, Davis, I have one more piece, and then just in talking about next steps, so things that we're going to be working on in the coming months. Continued review of critical data elements. So the Coordinated Entry Committee, and we have certainly identified the critical data elements that we want to look at for system performance. I've reviewed 4 of those pieces with you today in relationship to how are people accessing the coordinated entry system. If you participated at our annual meeting this summer, you know that both as a state but also regionally, we talked a lot about ways in which we want to make sure that people are aware of how to access the system, not unlike, Lily, your question that you just brought up. You know, how are we getting information to people in relationship to access, and how are they accessing the system in ways that best meet their needs? And that'll be something that we'll continue to look at. In addition to both the assessment type, so if they're completing assessments, how do we ensure that people are connected with the housing type that is most appropriate for them to achieve housing stability and maintain it? So you know that there are some differences there that we'll continue to look at, and those really influence our ongoing discussion around housing capacity and the types of supports that are available in each part of our community. COVID-19 response is a big piece of coordinated entry. You heard Denise talk a little bit about some of the additional dollars that are coming into the state in the second round, in addition to the discussion at the very beginning of our meeting around how do we prioritize and adjust from a coordinated entry standpoint to make sure that we're responding to those households that are higher risk for COVID-19, whether that be due to age or pre-existing health conditions, or living in congregate settings or environments which make them predisposed or at higher risk for COVID. There is a great deal of help and information that HUD has released nationally, and also with our TA providers that we heard from earlier today, that we'll be talking about how do we reprioritize their coordinated entry specifically in response to COVID. One of the pieces that is so critically important in making those decisions is input from you as providers. Because if we're going to make decisions about what will work best around our response to COVID-19, making sure that we have that engagement and response from you is the only way that that's going to allow us to do that in a way that's successful and meets people's needs. And just engaging people with lived experience. So that's a piece I know that Denise had mentioned, I think Davis did as well, and you know that we've talked about that for some time. We certainly have a mechanism by which we receive feedback from you, either on an individual basis based on our partnership or through your engagement with the committees that the consortium has.
we need to continue to move forward with mechanisms by which to engage feedback from people with lived experience. And so those are really just, there's lots of other work that we have to do, but those are really three action steps that we'll be working on in the coming months. And certainly, as Davis and Denise pointed out, we are certainly available for either individual conversations, or if you are a member of one of our committees, thank you for your participation and your feedback during that time frame, because that's where we are able to make very informed decisions along with just an interpretation of our data sets. So, any other questions before I release everyone for a much needed break? Okay, thank you very much for your time, and I think a break is next. Is that right, Davis?
Yeah, let's thank you very much, Stephanie and Denise, for your guys' presentations. And yeah, let's go to our break. If I can move the slide. There we go. How about we come back at 1:20 Central Time? So let's take a break, use the bathroom, grab a snack, and we'll start again at 1:20, and then the meeting will end at 2:30. That's our plan. So.
And people can just stay logged on. You don't have to log off and come back in. We'll just leave the thing open so everybody can stay on.
Great idea. Yep. Stay logged on, please. Okay, we'll see you in just a minute. Hi everybody, this is Davis, South Dakota Housing. It's 1:20. Hopefully that break provided you guys a little nice little time there. Our next item for the consortium for today is our committee reports. And the first committee we have listed is the PAC. I'm not sure if Alex is on or not. Alex Miller. I didn't see her name. She might not be able to attend today. Is Sherry, are you on the call still? Sherry Scudder?
Yes, I am.
Yeah, Sherry, I have some items that Alex and I had discussed about as far as some report items, but I don't know if you would like to go ahead. If you had any items that you would like to report to the consortium involving the PAC being the vice chair, is there anything you'd like to report?
No, I was just going to report on the things we've been working on, the policies and procedures and the YAB and the Black Hills and South Dakota Homeless Coalition, those issues we've been discussing. So if you have more detail, that would be great.
Okay. Yeah, I have some items, and then I know there's other PAC members too, so we'll make sure you guys please contribute to any you'd like to report about the PAC. But, the PAC continues to meet. We have a monthly meeting schedule. The PAC completes all of the official business of the consortium, including voting on issues of policy and documents and that sort of thing. And so over the course of this last year, we've gone through and done an update on all of our official documents. So they've all been updated. That's a process that just continues throughout the year, and we anticipate, we have a yearly process, but especially with the HMIS NOFA activities, we've even been doing even more than that because we continue to have updates. And then there's different other items that may come up throughout the year that need official sort of PAC approval and that kind of thing. But so that's a big part of the time that the PAC spends. Over the course of this last year, the organization of the Policy and Advisory Committee, which is the COC board, so it's the governing board for South Dakota Housing for the Homeless Consortium. That's what the PAC is. Restructured how they were organized from sort of having two co-chairs, was what was in the past, to a chair and a vice chair, and then retain the secretary position. And so Alex Miller is the chair, and Sherry Scudder is the vice chair, and Kim Hansen is the secretary. And so all those guys and all the PAC members fulfill very vital roles, but Alex is the leader, and Sherry is the vice, and then Kim.
How about
Go ahead.
How about if I let you start off with that part?
Yeah, go ahead.
With the chairman and the vice chair, the restructuring.
Yeah.
And then I can go ahead with how we conduct our business.
Sure. Go ahead, Sherry.
So if you want to do that, then that way you can introduce us that way.
Sure. And then Kim Hansen, she does the she helps us out with the minutes and keeping track of our official documentation of each meeting, which we do post to our website. So go ahead, Sherry. If there's anything else you'd like to add.
Okay. Yeah, if you want to go ahead and do that part, and then I'll just go ahead and add on.
Yeah, I did. I mean, we're on the meeting right now.
Oh, I'm sorry.
That's okay. No problem.
Hi, everyone.
Hi. That's okay.
This is Sherry Scudder, and I'm the vice chair of the PAC committee, the Policy Analysis Committee. And yes, we have been working pretty diligently with our monthly meetings, and I think now that I know that I was already on with Davis, then you pretty much heard that. But we are the governing body of the South Dakota Consortium, Homeless Course Consortium. And we keep pretty busy. I'm involved with several committees myself, with the Veterans Committee, the Youth Advisory Board Committee, the South Dakota Coordinated Entry, ESG. So there's a lot of work that goes into a lot of these programs, and to help me better understand it as a PAC member, I just listen in and try to learn as much as I can so that I could be very helpful on the PAC committee. And that's what the committee basically does, is they are the governing board, and therefore the more knowledge that they gain, the better they are. So there's other PAC members on, and like I say, I thought Davis was rehearsing with me, but so that worked out okay. So if there's any questions, I'll be glad to answer any questions you might have. Or any of the PAC members want to speak up, they certainly may. I guess we covered it, Davis. Thank you so much. I thought we were just rehearsing.
No, I know it. Yeah. It worked out good.
That's okay.
Yeah.
That's okay. Any other questions?
Yeah, I'd like to mention too that one of the big things that you kind of talked about a little bit, but the Youth Action Board and working through the funding grant for that was really a big milestone for the PAC this year, I think.
I think being involved with the Youth Advisory Board has been really a tremendous strength, and with South Dakota Housing helping them with their funding to get off the ground, I think it's so very important until the grant itself is approved or accepted. This way we get the homeless kids, the youth, working. And then Pennington County Housing also has a youth voucher, which we're going to try to explain more about so that more youth that are aging out of the system would be able to participate in. So I feel it's very important for that committee.
Yeah, good point. The FYI vouchers, yep. Yep, good point. Does anybody have any questions or comments or concerns or anything like that? Or questions about the PAC or any questions for PAC members? So, super important position. They do a lot. They work hard in their jobs. We appreciate them very much. A lot of responsibility. A lot of decisions are made. It's the governing board for our organization. So, anything else? Yep. Okay. So, if not, the next committee is the Veterans Committee. And I think there's some different folks on that are involved in that committee. I don't know if Tina is available to give a report. We had talked, but she might actually be otherwise just indisposed currently. But we have a really active Veterans Committee. We meet bi-weekly for our by-name veterans meetings, where we manage the by-name list of all the homeless veterans that we know of in South Dakota. So we work really closely with the VA and the SSVF providers, the Volunteers of America, both Dakotas and Northern Rockies, and then the state is involved in our larger committee, and so and a lot of other folks too, housing authorities. So we have a pretty good membership as far as our veteran committee on a statewide basis, and then with our East and West by name list meetings. So we've moved our actual statewide meeting to really bi-monthly at this point. It just seemed like it worked our schedule better, but we go over the list, we look at trends, we talk about situations, share information involving veterans and homelessness. So is there any other folks from the Veterans Committee that would like to to report anything?
This is Sherry. Just to let everybody know that our homeless veterans are pretty much housed rather. So we do have some vast vouchers available, but we're doing a really good job on the veterans portion of housing the veterans.
Yeah, it's been a tremendous learning experience for me. I keep that by name list, so I see the sort of the volume that comes in every couple of weeks, and then the volume that goes out as far as veterans that are being housed, and it's tremendous to see that effort. A lot of veterans are being housed all the time. So, all these agencies work together to identify folks that need assistance and all throughout the state, and then do their best to meet their needs. So it's really a organized effort.
Hi, Davis. This is Jade with SSVF. The one thing I would like to maybe share, since Tina's hopefully not available at this point, but maybe can follow up at a later point. In looking at the last year, because I've been with SSVF for 7 years, there has been a significant increase in the number of families we've basically served across the state. And the nice thing, like you mentioned about the by names list, I think that we're housing them fairly quickly. And I think as of recently, the numbers seem to be a little bit less than what they had been previously.
That's excellent. And that's in Jade Ronk from Cornerstone Rescue Mission SSVF program. Yep. And Jade, I know you had talked to me, recently about the volume that you guys had served in this past year of families.
Yes.
And it was incredible. Do you recall what that was for the volume?
In previous years, our target usually is around, let's say, between 225 to 200 families, and sometimes we go over that. But this last year, I think, if I remember correctly, because I don't have it right in front of me out of HMIS, I think we served just about 100 more families than that in last year, based on previous statistics. So when I think about 100 more families, to me, with the staff that we have and the work that we do, I go, that's pretty incredible when you see those numbers. And obviously there are factors that contribute to that, whether it's COVID, time of year, the population that we serve that's older, or whatever it may be, but that's a significant increase.
Yep. Almost 1/3 increase. Very good. Anything else, Jade, or any other?
Not that I can think of at the moment.
Awesome. Thank you. That's super helpful. Any other folks from the Veterans Committee or, the VA or any of the other organizations like to report anything? All right. Pretty dynamic group, I can tell you that. Point in time count is the next committee. So, gosh, and I know there's a lot of people that have been attending that meeting that are on the call too, so chime in. But we started a meeting this year in about July to address, try to address different things and get a jump start on things. Obviously, COVID has affected our planning tremendously as compared to the past, from my experience. Continues to be, the safety parts of all that continue to be on our minds, and we're working towards doing the best we can with that. We meet on a bi-weekly basis at this point, and then we also meet on the off weeks with our regional and city leads. We're meeting, so we have two kind of bi-weekly meetings, one with the larger committee and one with kind of the leadership for the regional and city leads. So one thing we're introducing this year compared to the past, and I know we did a report on it, so I'm not going to talk a lot, but it's training videos. So that's our and that's part of our answer to COVID as well, is that for safety, for training wise too, bringing people together for large trainings probably is not as wise as it had been in the past. So we have to really roll with the punches, and also then people have access to it on their own time to view the video for training. So anybody else from the PIC community like to report anything? Or any reports on local efforts?
Davis, it's Sarah. Are we still making like a determination on what pit count's going to look like? I know that we initially had like December 17th as the kind of the go-to day, or do you have an update on,
Yeah, well, yes, thank you. We did go through everything with the PAC and just kind of got, from, if you recall, like from our meeting, sort of I think it's the agreements we kind of came to for the pit count. And really it affected the unsheltered part more than anything. And then the idea that we would, use a shortened survey for the unsheltered part of the point in time count in order to cut down on the amount of time and mitigate risk. So we'll use a shortened survey. And then also the time frame we looked at, kind of cementing that. Which is, I think, what we agreed to the same dates in that committee meeting, which was the count date is the 26th, and then the unsheltered count would go through until that next Monday, which is February 1st. So that was really the main, things that would be different or decided. But yeah, I think that the PAC kind of just supported that. So, and that was kind of the determinations we came up with within our committee that last meeting. So. Does anybody have any questions or comments about that? So the housing inventory charts and the sheltered count will be largely the same they have been in the past. I mean, basically the same. It's the unsheltered part due to COVID-19 that we'll see some adjustment. And we really worked through in the committee and just kind of said, okay, these are our options, in a committee process. And and I think we all came to an agreement that seemed agreeable to everyone, and then we just wanted the PAC to be kind of aware, and then they gave their blessings, basically. Any other questions or comments about the pit count? Huge undertaking, you guys can imagine, and really rolling with it. I mean, this year it's just unprecedented challenge. Trying to do this throws a wrench into things sometimes, but try our best. Any other questions, comments? PIC committee. And again, like Sarah said, we'll meet again on the 17th. So, and I know you guys locally too have different meetings and things set up and are thinking about trainings and reaching out to the housing projects and the different service providers and that. So, okay. Next committee, HMIS. And some people I've learned from our meetings they call it HMIS, don't they, Denise?
They do. We've never called it HMIS in South Dakota, but
trainings, yeah.
Seems odd to even think about calling it that now, but yeah, in other states that is what they call it. It's HMIS. Afternoon again, everybody. Not, HMIS really, if you haven't noticed, is comes up in most of our committee conversations, comes up in most of our topics. So HMIS is kind of an ever-evolving system. Of course, our database system that we use for all of our federal reporting, even our coordinated entry, which is kind of a manual report that we do right now, will have a CSV, which is a comma separated value report that will start running the end of next year for submittal instead of doing a manual report. So we've covered a lot of stuff that happens in HMIS. So the biggest thing happening, probably two of the projects right now, is getting our training platform up and running. And then also the other project is we're working on our prevention build out for coordinated entry. So that will also be happening in our HMIS system. So those are probably two of the big projects happening that will have some significant changes to those specific programs in the system. HUD has also informed us that there will be data updates next year. For those that aren't familiar, HUD goes on a 2-year cycle for data system updates, and so there will be some new data element updates happening next year. So what usually happens is those updates are released to the vendors, usually around April. The vendors then work in the system to make sure the system is compatible. It usually gets released for testing to the states in September, and then has to be live by October 1st. So on top of some of the other things that will be happening in our system next year, we'll also have some data element changes coming down from HUD. So I'm hoping they're not going to be significant with everything else going on. They know that agencies and shelters and the people kind of on the ground, like all of you, are dealing with a lot of stuff right now with COVID and the population that you all work with. So I'm hoping there'll be minimal changes. But as soon as we get any information coming down from HUD, we'll make sure to pass that information along to the agencies that it pertains to for those data element changes, and just keep everybody updated. Once we are to the point where we can do some practice sessions for our prevention build out and for our training module, those will probably go out to the HMIS committee first to make sure that we have some agencies that are willing to go in and do some practice for us while those different things are in testing mode. We usually include our HMIS committee and then reach out to the agencies that work in those programs to help us do some testing too. So it's kind of a nice thing about our training site is we can always go in and do testing to everything before it actually goes live in our system. So I think that's all I have to update right now, unless somebody has questions or comments on the HMIS system, but always evolving.
I think that hits it right on the nail, right on the head. Always evolving, always changing, always developing, always expanding, isn't it?
Yeah, I think, like I said, HMIS was mentioned in every single topic that we've discussed today. So it's really just a central mechanism in whether it's federal programming, whether it's our coordinated entry, whatever it is. It's just really a central part of all of our continuum of care. So
that's for sure. Do you guys have any questions for Denise or for other folks that attend the meetings? All right, thank you. If not, how about youth committee? So a lot's been going on with the youth committee in different ways. Andrea, are you on the call at this time?
Yeah, I sure am.
Hey, do you have any comments you'd like to make?
Yeah, just a few things. We had a meeting in November. We kind of discussed, we had had a break of a couple months just with everything going on, but we had set some goals. So the youth committee goals that we have set and are going to be moving forward with are supporting the Youth Action Board. I'm not going to touch a whole lot on that because they're doing a presentation here later. Also supporting the Youth Homelessness Demonstration Program application completion. And reestablish monthly committee meeting schedule, which we have done. We actually have a committee meeting coming up on the 17th as well at 4 o'clock. And that then we're going to be going back then a monthly, the third Thursday of the month at 4 o'clock. Develop plans for documenting homeless youth and collect data. Develop informational resources for shelters and groups to assist youth, and to support the expansion of the Foster Youth to Independence program, the FYI, to additional public housing authorities in South Dakota. So I think that's a really solid set of goals and gives us a good direction. And yeah, I'm excited about it.
That's awesome. Thank you, Andrea. Do you have any questions or comments or anything like that? Or other folks attend youth committee? We had some overlap for quite a while, with the YHDP, the Youth Homelessness Demonstration Program. It's a mouthful. Application work group. We had a lot of overlap there, so we met with that group kind of for a while, but waiting on that NOFA to come out. We decided let's get the youth committee up and running again. Realized that there was a lot of overlap there for several months. So it's awesome we're back to go on again. If you want to join the youth committee, if you're not on the email list, send me an email, or Andrea will get you on there. Any other questions or comments about that?
Andrea, this is Olivia Snoke with Lutheran and Social Services. We are doing the case management portion for these FYI vouchers. I was just wondering what your plan was to get the word out on those vouchers, because as I understood it right now, individuals have to contact us at the COT team at LSS to get their name on the list. Are you guys thinking about adding it to the Section 8 application on the website, or?
We certainly can, and if you have some suggestions for us, you can certainly email myself or Davis before a meeting. I don't think we've gotten that far as how we want to support that expansion, so any suggestions or experience that you've had or requests would be very helpful for us to give us a good place to start from.
Yeah, absolutely. We sent a lot of things to Lisa, who's the director of Hamilton County, but yeah, since you guys are working on it, it seems like we should be teaming up.
Wonderful.
We got some background noise coming in from somebody. I'm not sure who it's coming from, but thank you.
Yep, thank you. That's great. Any other questions or comments? Yeah, developing a strategy, FYI, to expand that to other communities would be potentially life-changing for a lot of for youth that receive that. So it's a housing program, a voucher program similar to other, like the housing choice voucher, but it's FYI. It's similar but different for Section 8, but it's targeted towards youth that have an experience with foster care, sort of the short explanation. And then housing authorities actually administer it. And right now it's being administered in Rapid City or Pennington County, but we would really like to support that to other communities in the state. And LSS and Department of Social Services in Pennington County Housing Development Authority work together on that, especially those three groups. So, and we want to support that and support the expansion of it to other areas. Anything else on the youth? Lots going on with youth. And we're going to hear from the YB in just a little bit. But how about coordinated entry wise? Stephanie, I know you gave a very thorough report. Is there any other committee information you'd like to share?
Well, I think that, you covered it in the update in terms of next steps. The Coordinated Entry Committee does meet on a monthly basis, and we have a broad range of representation from each of the regions. So if you have an interest in knowing what's happening specifically with that piece, we can certainly either add you to the committee, or I can put you in touch with the agency representative or the regional representative on the committee to just give updates. I mean, the biggest pieces of work for the committee in the coming months, and these will be rather large decision mechanisms, will be around the review of our data sets at those critical data elements, and also making some decisions in relationship to reprioritizing due to COVID-19. So the way that is going to impact each of you as providers, if you receive referrals directly from coordinated entry, which many of you do, that as we make decisions about prioritizing or reprioritizing specific to COVID-19, that will be the time to give input on those items at the committee level prior to them being adopted. So that and the piece around engaging individuals with lived experience. So.
That's great.
And I see a number of committee members are available on the call here. So if you have additional things to add, please do so.
I would add
This is Sherry.
Oh, go ahead.
This is Sherry Scudder. I just wanted to add the coordinated entry system. I just wanted to add that the case conferencing has been just excellent in trying to help that system through as well. So I just wanted to mention the case conferencing was so important part.
Thanks for that comment, Sherry. I think that's case conferencing is one of the most impactful pieces of making sure that we understand what's happening with families locally and their connection to communities. So thanks for that.
Any other comments? All right. Well, I can tell you the coordinated entry system continues to develop. Just like Sherry said, case conferencing is a very good example. It's amazing to see the progress being made. So it's wonderful. Any other coordinated entry committee comments, questions? I wanted to mention too, this is Davis again, that those committees that you see, those are our 9 official committees of the Homeless Consortium. So those are in our governance documents listed as our official committees, just so you know. And the next is Homeless Summit Committee. And again, due to the COVID-19 situation this last summer, we weren't able to have our Homeless Summit as we have had in the past in June. I think I've had a number of conversations with people. I think just this last week, the latest one was with Paul Miller too, just talking about, the hope. I think a lot of us are really hoping that by this summer, maybe it's a possibility we have that again scheduled. So, does anybody have any questions or comments about the Homeless Summit? So,
I think it's a good time to remind people too, Davis, if you have or even virtually seen any really good speakers or really good presentations that you think would be great for across the continuum, please always send that information, shoot an email to Davis about who the speaker was or what the topic was, or even if you're thinking of topics that you think would be good. I know a lot of people on the call have been to previous homeless summits, but just really thinking about topics and speakers and all that information. And we've all had access probably to a lot of different maybe speakers and presentations over the last several months that maybe were only previously done in person, and maybe people just didn't get the chance to travel as much as they would like to some of those presentations. So we all have had access to a lot of different, I think, speakers over the past several months. So just always, if you hear a good presentation or something that you think would be really, really helpful across the continuum, or advantageous for us to hear or educational for our continuum, always feel free to shoot that information over to us. So
good point.
Denise, I think the other thing I would add to that is if you yourselves would like to present on either promising practices or service areas that you find are successful from your organizations, we're always looking for provider perspectives as well.
Absolutely. Absolutely.
Okay. So, yeah, we'll be, I think, monitoring the situation and discussing options and hoping for the best, and but communicating and like those guys, they said, please share your ideas and information and speakers and contact information too for folks that you have. It really is helpful.
I had one idea. This is Jamie. I recently participated in actually a few of us from Rapid City participated in a police mental health collaboration 3-part webinar series, and there were some really great presentations throughout that webinar series that really focused on sort of community perspective on gathering data around homelessness and how to better address the homeless situation. Because police officers are often the first responders to a lot of issues involving the homeless population. These presentations really focused on how partnerships with police officers and police departments between, mental health providers and some homeless providers can really benefit sort of that response in general, but then also in terms of like collaborative data collection to just better address gaps in the system and to understand, what better strategies there might be in addressing some of these issues in the community. So I believe I provided some of that information to Stephanie and Davis and Lorraine, but can send some specific speakers that might be useful for that venue. If folks are interested. If not, that's cool too.
Yeah, please do. Please share that. I'm trying to think, was that 2 years ago we had the Sioux Falls group that worked in a similar but probably different. We had some speakers, and it seemed like those were well received from the police department and from mental health and working together. So yeah, no, I think that'd be great. Please share that.
Yeah, and I think that brings up a good point, Jamie, is really, truly at this point, any topics or suggestions or, we really take in any of that information that people are willing to share. And then our Homeless Summit Committee can kind of go through all of the different suggestions that we've gotten and look at, what topics we think kind of in years we figure out maybe a theme that we're going to use or whatever. But really, I think any suggestions or, anybody has can be sent in. I mean, I don't think there's a right or a wrong or anything else. If you think it's beneficial in your homeless group or your homeless coalition in your community has, seen something that you thought was really good and really beneficial, we should, sending that along is definitely appreciated.
Absolutely agree.
Okay. Any other questions or comments for the Homeless Summit related? And I think, we could entertain if we couldn't do it in person again, maybe this year we would look at some kind of virtual thing. I don't know. So we would have to work that out as a committee and as a consortium. But I think a lot of people would sure like to be able to get together again, obviously. Okay. Well, thanks for sharing. Native American Committee, and I know there's been different folks on the call that have been participating. We're meeting monthly. We've had really good turnout and really good conversation, and we also worked out a set of goals that we've been working on moving forward too. Really good discussion on a number of different topics related to Native Americans and homelessness and related topics. Is anybody else from the committee that would like to share any information from that? Certainly welcome to. You guys recall Jean has retired. She was a really good partner in that committee for years, being involved. She has retired, but some of the staff are taking over her role up there, Gracie and some other folks. So, but any questions or comments or on Native American Committee? If you'd like to join, again, shoot me an email. We'll get the invitations out to you. We've been having like I said, very good participation recently, so that's awesome. All right. If there's no other input on that, the Youth Action Board is a recognized and fully equal committee, approved by the Policy and Advisory Committee as part of the governance charter. So the YB is a official committee of the South Dakota Housing for the Homeless Consortium. I believe there's some folks on. They've shared with us some presentation materials. I'm going to queue up. And you can see, look at that, they already got me beat. Their technology is. Is there someone from the board that's prepared to present?
Yep, I am right here. Hello, everybody. My name is Michelle, and I am here today to talk with you guys about the Youth Action Board. Our Youth Action Board is a coalition of youth working together to help battle youth homelessness, and we have been meeting since June of 2020. And today I have come to speak with you guys about what we've done these past few months and what we are planning to do. And if you will go ahead to the next slide. What is the Youth Action Board? As mentioned earlier, we are a collection of youth coming together to battle a hardship most adults have issues with, homelessness. As a group, we meet once every second and fourth Tuesday of each month to work and collaborate on different issues to help our community become a better place. Our mission statement is, we are a youth-led group that advocates, educates, learns, uses, and gains resources to create a positive change in the ongoing homeless youth problem in our community. Next slide, please. So far in the past couple of months, we have covered a number of different topics associated with developing our board and retaining our members, as well as getting incentive funding, all in about 6 months. Our group has worked very hard and plans to work even harder to do what we can for our community. And on this slide, we do have a list of a few of the things that we've done so far. Next slide. One of the topics we have discussed multiple times is the Youth Voice Input Survey. This survey includes our $1 million question, in which youth were asked what they would do with $1 million in relation to homelessness with the community. Many of the youth who had filled out the survey had recommended a program to provide basic needs to those who may not have the ability to afford these, such as food or water. Multiple agencies, such as Connecting with Our Youth and McKinney-Vento, among a few others, have received these results as a way of asking these agencies to support us and our goal of helping youth homelessness. Next slide. Engaging young people has been another topic we have been earnestly discussing, as young people are full of ideas and information on subjects that adults may not view in the same light. Different methods have been used to increase our attendance and engagement, such as social media coverage and incentives. Recently, we have been focusing on getting the word out to youth who have already been or are currently experiencing homelessness, as those youth have the most knowledge about what they don't have and are in need of. We are a key part of this group and have done so many things in such a short time, such as getting our proposal funded quickly and to the amount that we had requested. And more youth with these kinds of experiences will be more beneficial to the future of our group and the community. Next slide. To have a group, you must have people. We have been striving these past few months to recruit new people to join us as we work towards our goals by providing incentives, making flyers, using social media such as Snapchat or Facebook to spread the word, and using our mentors as resources for recruiting. One of our current members has actually made the flyer over on the right, and we have been using it as our face for our recruitment. Next slide. speaking of incentives, here are a few of the places we've spoken to about these. Recently, we had received $625 worth of gift cards to give out to youth who had attended our meetings and had distributed them out to needy youth. Our proposal to the PAC had been approved, and we're currently waiting on that to distribute out to the rest of our youth who have become more recent members. Our mentors have been working hard to help our grant writers together, or to help get our grant writers together for the application of a grant of $1 million at minimum, and we have been excitedly waiting for this to get going. Next slide. Another topic we have discussed is our roles and responsibilities, and we have recently come up with different roles and responsibilities for each of our members, for both the mentors and the youth, and also with the expectations on both sides for these. Next slide, please. Our future goals and objectives have been something that we have been continuously working on, and we have actually worked through quite a few of our other goals, the ones that we had accomplished previously. A lot of these are mainly focused on trying to collaborate with different people and to provide support to the people who are in need of this kind of supports. We are mostly working towards getting a safe place where young people can go when they are in an unsafe environment. We are trying to get resources together to give them a temporary place to stay and to be safe. Next slide, please. A few of the things that we have been trying to deal with, we have been speaking about different issues in relation to shelters and on helping adults understand exactly what sort of situations these sorts of things are. A lot of what is shown on the slide is different roadblocks or issues that we have had with incorporating people into our group and also getting things together for safe places for the youth. This is a lot of some of the same things with our future goals and objectives that we have been trying to get together to make these sorts of issues easier for the youth. And we have just been trying to find the best way to support some of these people. Next slide, please. And that concludes my presentation. Does anybody have any questions?
Michelle, that was a great presentation. We should definitely appreciate all your work and all the work of the Youth Action Board and the folks that are also supporting that. Does anybody from the consortium have questions or comments?
This is Sherry Scudder again. I just wanted to say that the Youth Action Board has really taken the bull by the horns and really gone forth and worked with their population to get the development application together. And also we have a great bunch of kids, youth, that are putting forth their whole heart and soul. So I appreciate the comments that Michelle has given, and also I appreciate South Dakota Housing being able to step up and helping.
Thanks, Sherry, for that comment. I would just also comment, thank you, Michelle, for that presentation. Like Sherry mentioned, I think to watch this evolve over time, over the last couple of years, and really have a lot of support and structure around it, and have that engagement from a youth perspective, because that population experiences specific barriers, is really an encouraging thing. So looking forward to the continued work.
This is Olivia Snoke. I am one of the mentors that help with the Youth Action Board. I would be remiss if I didn't take this opportunity to not only shout out the YAB for working so hard. I believe they spend about 6 hours a month working on this Youth Action Board. So we're really honored to watch them work, and the creative juices, and asking super thoughtful questions, and looking at how to solve the issue of youth homelessness. But I also want to talk to each of the others who represent an agency or a coalition and say that because the Youth Action Board is up and running, and we do have funding for incentives, which include $20 per youth per meeting, and after a youth has attended 4 meetings, we give them an additional $25 gift card. Do make sure that if there is someone who's under 24 and is passionate about homelessness, please make sure that they get the information for the Youth Action Board so that they can join this passionate group, because we do want to have lots of people and more input, and each of you would be a great advocate for gathering more Youth Action Board members. So do keep this in mind.
Thank you, Olivia, and Michelle again. Keep that in, yeah, like Olivia said, keep that in mind, and we want to see this board expand, so to other areas of the state. It's a great model we've got going, so great job, you guys, good work. Any other questions or comments or anything like that for the Youth Action Board? All right, well, wonderful. And thank you again, Michelle, for taking time out from, I'm sure, all kinds of things going. We definitely respect that, appreciate that. Okay, if there are no questions or additional comments for the board, YAB? All right, well, let's move into the town hall portion. I know it seems like folks have generally been maybe a little more quiet today than sometimes in general. I know a lot of you have spoken, but a lot of people have not. This last 15 minutes or so is a chance for you guys to kind of give us some reports on your agencies and your communities. And please do so. I know we have a lot of folks on the call still from a range of different agencies. I know obviously COVID-19 is on everyone's mind, and issues related to that, but there's other issues also with the communities and with agencies. So is there anybody that would offer us a report? One announcement I want to make is that we know Madeline is going to be leaving, Allison is going to be leaving Helpline Center, or her role in Helpline Center, and we wanted to just acknowledge her contribution and the wonderful job that she had as she changes roles. That's one thing I wanted to make sure I mention in our meeting today.
Thank you, Davis, for noting that. This is Stephanie. I had forgotten to mention that. We did just learn this morning, too, that Emily Morgan will be taking that role in the first part of January. So if you've been with Coordinated Entry for a while, you are familiar with Emily. new transition housing specialist, and we'll be working with Helpline to get her on board. And again, thank you, Davis, for that. A shout out to Maddie in your next endeavor and all your support.
All right. Is there any? I might just hit. Let's just hit regions quick. Is there anybody from Region 1, Rapid City, or the Region 1 area would like to give us any info on community or agency-wise, any information?
This is Sherry again. I just wanted to mention that we will have a new executive director beginning January 1. His name is Brian Ochbach, and I know he'll be out in the community.
Okay, so there's a new executive director at Pennington County Housing.
Yes, I'm sorry.
Who's probably going to be getting lobbied about the FYI program, right?
Right.
For instance, yeah, I gotcha. So Brian Offbach?
Yes, January 1st.
January 1st. That's super
This might be a good time, too, to remind people, most of you probably have heard, but Lorraine Polak, who right now is our director of our rental housing development department, which is where Davis and Stephanie and I all work, is going to be the new executive director of South Dakota Housing. Mark Lossing is retiring, so Lorraine will be taking over that position January 8th. So the job for the director's job is out, and I think that closes on the 18th of December, if I'm not mistaken. So more changes coming, but we're lucky that Lorraine is being able to move into that position and will continue to lead South Dakota Housing in an awesome, great way, I'm sure. So
I would second that too, and super fortunate to have someone with her experience in the homelessness realm, right, in that position. That's going to be very good for us, the homeless consortium. Anyone else from the Rapid City Region 1 area?
Sure, I will go. My name is Dion Krusch, and I work at Bethany, and we have started a new program called Renew, and Renew is a maternal wraparound program for recovering mothers with newborns. It's a specialized case management model that supports pregnant women with substance use disorders. And then we hope to get involved with these women while they are pregnant and follow them through a year after the birth of the child. We are offering this program in Sioux Falls as well. And so we just want people to be aware of it, and you can make referrals directly to us. We are just always so thankful to be involved with this, as well as many of our clients suffer with homelessness, and we're very thankful for all the work that everybody does on this committee.
Thank you. Anyone else from Region 1 or Rapid City or Region 1 or that whole territory?
Hey Davis, this is Heather with the VA.
Yes.
I just want to let everyone know, like usual, we still have vouchers available for veterans. We've halted our face-to-face, but we still see people as needed in an emergency for like housing and stuff. So if anyone has a veteran who's homeless, give me a call.
Thank you. Is there anybody else? Region 1? All right. If not, how about Region 2? So sort of Pier over to Aberdeen and to Sisseton and down to Huron. Good way to describe Region 2, I think.
This is Andrea up in Aberdeen. I'm with Safe Harbor up here too. I guess I know I can speak for Journey Home as well. It's been fairly busy. November picked up a lot, I think, for both of our agencies here in town. Over that time frame, we're seeing a lot more needs within the community. I also just wanted to take just a second to acknowledge someone who was on the youth committee before and also just a champion for children in our state. And I don't know in what other capacity she's worked with housing or with the homeless consortium, but that's Laura Johnson Frame, who passed away in November. She was a state PTA president in the 80s and continued to work with the state PTA up until she passed away and was also on our youth committee. So just wanted to acknowledge her contribution to us and to those youth that we serve.
Andrea, thank you for doing that. Laura Johnson Frame did attend our homeless summit and was active across our continuum also in different meetings and all of those. She usually always attended the quarterly meeting and participated. So I appreciate that.
Absolutely.
Yeah, thank you.
Yep.
Department of Education. Any other comments for Region 2? Central South Dakota wise, we're one of the targeted areas for that set aside that Denise talked about in the ESG. One of those target areas of Central South Dakota, FYI, just another plug for that. Please be thinking about that, agencies. There's a lot of need in our area. Our peer local group continues to meet on a monthly basis to discuss homelessness concerns and issues like that, poverty in the peer area. Is there anybody else from Region 2? If not, how about Region 3? Gosh, kind of winter all the way to Yankton, those southeast tiers, south central tier of counties. Rural, or Rocks, kind of Rox's area, I guess, is another way to describe that. Is there anybody from that area? I don't think Joseph is on today from Yankton.
Can you hear me, Davis?
Oh, I do hear you, Joseph. Go ahead.
Well, I mean, right now it's all eyes on getting some folks out of shelter. It's if they're not leased up by Friday, they probably won't be anybody moving out until January. That's a big focus. Still waiting to begin renovation. We're to effectively double our bed capacity with our basement renovation after being told we'd need to put another $30,000 into our plumbing all the way to the municipal line. And just, talking to landlords who are eager to make their problems our problems by selling us some apartments. And I think we're crazy enough to be considering it.
Yeah, thanks, Joseph. A lot's going on at Pathway Shelter in Yankton. We can sure tell that. You guys are doing a number of different things. Thank you for that insight about just the practical nature of housing people too, that you just offered when you talked about trying to get people out by Friday. And I mean, I can understand that on a lot of levels. So thank you for sharing that. Is there any other reports from Region 3? I don't know if Darcy's on from Rocks, but is there any folks agency-wise?
Darcy was on, but I don't see her now.
Okay.
She must have had to leave.
Anyone from the, I think, is it River Cities Domestic Violence?
Yep, they're in Yankton.
Is there anybody from that agency on by chance?
I don't see them on the call today.
Okay.
Johanna was on, but she had posted earlier she had to leave. Yep.
Okay.
She was helping a client.
Yeah, and I know people, and believe me, we know a lot's going on, guys, that you're helping people in. How about Region 4 then? Is there anyone from the Sioux Falls and those counties from Sioux Falls up to Watertown, that area? Any reports from there?
Hey Davis, this is Dawn Sickink with Beacon Center.
Hi Dawn.
Hi. trying to find the right button. You guys don't need to see me, but you
Yeah.
hear me.
We hear ya.
I got two others I think that are on unless they had to leave, so they can jump in and add to anything that I have to offer. But we have been relatively slow. This is kind of, we're seeing it kind of, it seems like it circled around just like it was when we started the pandemic. And I don't know if that's just people are afraid to come out and utilize the services. I'm not really sure exactly what's going on there. We are open. We're 24/7, so we're still there to provide services. We're seeing a lot of people who are not in shelter. We're still providing those services, but unfortunately, we haven't. I'm not quite sure. I wish I could tell you why we don't have anybody. We were kind of full, and then it surged, and then we haven't really. We've had a couple people who've inquired, but hasn't followed through to use the shelter. Other than that, we're just, day by day, I'm sure is like everybody else, just trying to make it through everything. And some of us are at home, some of us are in the office, but just trying to stay safe.
Thanks, Don. Anyone else have a report for Region 4, Sioux Falls area, other communities? Anyone from the shelters in Sioux Falls, the homeless shelters? I know earlier we had some folks on the call, but they could maybe let us provide any kind of report. Maybe there's not.
Yeah, I know there was some UGM staff on, but they might have had to jump off too.
Okay. Anyone else from Region 4 Sioux Falls like to make a report?
I know we do have some Sioux Falls people on.
I know. All right. Well, if not, we appreciate everyone's work. We understand the difficulties going on COVID-19, adding to the. We appreciate everyone being on the call, taking time out today and participating. Please communicate with us at different things. Consider joining different committees and activities within the and with that, we can adjourn.
Thanks, everyone.
God.